Say it for me. Oh yeah, you did it. You did it, Uncle. It works. Assalamu alaikum. We're about to get started, so if you don't mind, you can grab your seat, and then you can continue your consultations at the various booths after the panel concludes. But since we do have namaz time coming up, we will be beginning the panel now. Okay, we're ready to get started, so I'll just ask you all to settle down and grab your seats. Yes, you can sit if you'd like. I'm just going to start with opening surah and introducing the professionals, and then we'll get into the panel, okay?
Is the mic too loud? While it's loaded?
I think it's fine. Huh? I think we're going to introduce all the booth people first, so that's fine. Okay, salam alaikum. Welcome to our second annual health fair. Alhamdulillah, we're blessed to be gathered here today to talk about a topic that's so important to all of us, our health. Our community has an abundance of knowledge in this area, and the goal of this event is to bring together all of our community members and our community professionals. Our main goal today is to educate ourselves, learn about the resources available, and open the lines of communication. I want to take a quick moment to thank the Managing Committee of Al Mahdi Center, Brother Hasnain Aziz and his team, and Sister Rehana Jaffer and her team. They have been instrumental in creating this program for you today. Can we have a loud salawat for their efforts? Before we introduce all of the professionals in attendance today, I would like to invite Ali Raza Darsi and Rayan Ali Jivraj to the front to recite some verses of the Quran. Let's welcome them with a loud salawat. Just come on this side because it doesn't stretch very far.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وإن تعودوا نعمة الله لا تحصوها إن الله لا غفور رحيم. Ali Rida has recited Surah Nahl, Surah 16, Ayah 18. And if you should count the favors of Allah, you could not enumerate them. Indeed, Allah is forgiving and merciful. We selected this ayah of the Holy Quran because good health is a blessing, and being grateful for it is an important part of maintaining it. One of the most significant and taken for granted blessings is health. We may not be able to count every aspect of our health, how our heart beats, how our lungs breathe, or how our immune system fights infections. But all of these are divine gifts. True gratitude for health is more than just knowing we are healthy. It requires us to show appreciation through our actions. This can be expressed by maintaining our health through proper diet, exercising, and avoiding harmful habits. It also means recognizing the opportunity health gives us to live with purpose, to pray, to help others, and to grow spiritually. By reflecting on Allah's mercy and being conscious of His countless blessings, we can appreciate and take advantage of our good health and all that Allah has blessed us with. Salawat.
Thank you very much for that beautiful recitation and tafsir. Okay, so now let's take a quick moment to meet all the professionals who volunteered their time today to help you. As I mentioned earlier, you'll have a chance to visit the booths afterwards, but I wanted to make sure that everyone in attendance knows the different booths that we have and the professionals that we have here. You'll have to bear with me because we made a listing of all of this, and while I was on the other side last night setting up for the career fair, they switched a bunch of the booths and the orders, so let's hope I get it right, and hopefully if I say your name at the wrong time, you'll just wave and be recognized. Okay, so we're starting with nephrology over there. We have Dr. Muhammad Abbas Khalfan. Next to him, cardiology, Dr. Ibrahim Isa, who will also be speaking shortly. After that, we have neurology. Dr. Imama Naqvi is on her way. We have, out of order, sorry about that. For dermatology, we have Dr. Ali Raza Alu. After that, we have oncology, Dr. Raza Zaidi, and gastroenterology, Dr. Hina Zaidi, who will be speaking shortly. After that, we have geriatrics, Dr. Akbar Mitani, who's on his way, and Dr. Zamina Aziz, who I think is also on her way. After that, we have caregiver resources. Tyra Ismail is over there, you can wave, and Brother Ali Madad is also over there. I cannot read the sign that's after that, because there's a pillar blocking me. Anyone want to help me out? Nursing, okay, we have 3 nurses with us today. We have Sister Fatima Giwala, we have Brother Mahdi Jaxi, and we have Sister Zara Walji over at the nursing station. Say it again? Family practice, we have Sister Sakina Mukidinani and Dr. Aliza Raza. In the back there, we have mental health. Sister Fatma Dirani and Dr. Atika Ismail, you can give a little wave in the back there. After that, thanks. Over there in the back, we have nutrition. Brother Imran Sayed, who will also be speaking a little bit later. Next to that, infectious disease, Dr. Arif Darsi, who will be speaking on the panel shortly. Next to that, physical therapy, we have Ali Jawad Jivraj, and we have Maryam Ali Bukhari. Next to that, Imamiya Medics. Sister Maryam Ali will also be representing them, and we have a booth for Global Kindness Foundation with Sister Famida Darsi. Dentistry, someone had asked me about it earlier. We have Dr. Batul Rizvi in the back over there willing to answer your questions. We have women's health with Sister Rahila Sachidina. And after that, we have flu shots. Sorry, I'm really struggling with seeing the signs here. So if I'm messing up the order, but over there for flu shots, we have Sister Sajida Kiwala. We have prescription savings with Sister Shazmin Khalfan, pharmacology, Brother Muhammad Somji, medical insurance with our friends, Brother Firoz Mukhi has brought, and then summer swab to cure. I think we got everyone. If I missed someone, forgive me. So hopefully you'll get a moment after the panel is over and after Salat break to go around to all of the booths and take advantage of all of these professionals. Now I will, you know what, Brother Hussein Aziz, I had a moment for your opening remarks, but because we're coming up on namaz time, I'm just going to pass it over to Brother Riza Aziz to get us right into the panel. Let's welcome him with a loud salawat. Just your mic is caught under there. There you go.
Thank you. Okay. Assalamu alaikum, everyone. I would like to thank you all for joining us this morning as we begin our annual Sijni Health Fair and Career Day. My name is Riza Aziz and I will be your moderator for the first panel of the day, Prevention is Cure. I would also like to thank all of the accomplished individuals that are seated with me on this panel for taking the time out of their busy schedules to share with us their expert advice on this topic, and they will all introduce themselves very shortly. Today, the world of healthcare is headed towards a new direction, valuing the idea of being proactive with one's health and utilizing preventative healthcare in order to maximize the quality rather than the quantity of our lives. The Holy Prophet ﷺ has said, "Wealth is appropriate to a God-fearing person, but good health is better for the God-fearing than wealth." He further says, "He of you who finds himself enjoying good health secure in his community, and has his daily sustenance, is as if he had the whole world at his fingertips. It's like the age-old saying, health is wealth. Alhamdulillah, we are blessed with many elderly community members that are very active in our Jamaat, and long may that continue, inshallah. But what are the steps that we can take to ensure that all of us can remain active in our elderly life and ultimately fulfill our purpose in this dunya of continuing our submission to Allah subhanahu wa ta'ala and serving His Ahlul Bayt? And with that, I would like our esteemed panelists to give a quick introduction of themselves. They have all been carefully selected as members of our community in different areas of expertise who can share a little bit of information as to how we can approach the idea of preventative healthcare. To the audience, if you have any questions for our panelists, please save them for the end as we have kept allotted time for your questions. So, Ibrahim uncle, if you'd like to begin for us, please give a small introduction about yourself and what you do for those who do not know, and then you can share your thoughts about preventative measures from a cardiologist perspective.
Bar Muhammadin wa ali Muhammad salawat. My name is Ibrahim Isa. I'm one of the cardiologists. It took me 13 years to do medicine and cardiology and 30 years experience, and I have to do this in 10 minutes, you know. So now, actually, my practice is in New Jersey. I'm an invasive cardiologist. I do angiograms, pacemakers, TE, cardioversions, and all these things, and I enjoy doing them. And I'm here today to speak about the preventive aspect of the cardiovascular disease. As you all know, cardiovascular disease is one of the most important cause of death in the entire world, especially in the United States. 29% to 30% of the primary death is due to cardiovascular disease. Of course, there's a lot of other diseases of the heart, but the most important thing that causes death is ischemic heart disease. It means the blockages of the arteries going to the heart. Like any other part of the body, like the brain, the kidneys, the spleen, the liver, every tissue needs blood. But the two most important tissues that really cannot survive without blood is brain and heart. Once, if there is a cutoff of the blood supply to the heart, then it takes only like 4 hours to 6 hours before the heart dies. That part of the heart dies, you know. Similarly to the brain, if there is a cut of the blood supply, in about 5 to 10 minutes only, you can have an infarction, you can have a stroke. So the most important thing, of all the diseases of the heart, the atherosclerotic disease, the blockages of the arteries going to the heart by the deposition of the cholesterol is the key thing in progression of the disease. And if you want to prevent this disease, definitely there are certain measures you have to take place. First of all, before that, we have to identify what are the risk factors. The first risk factors is a man. Being a man, you are always at risk, and anything above the age of 40, 45, you start looking into your arteries, The second thing is the obesity, overweight. If you cross your BMI of like 29 or 30, you are at a higher risk of developing atherosclerotic heart disease. Number 3, hypertension. Hypertension is a silent killer. Hypertension is a silent killer, and sometimes you do not know. And if you not go to the doctors, you won't even know that you have high blood pressure, unless until if you have headache, lightheadedness, and then you go for physical, you see your high blood pressure. You have to be treated and make sure that your blood pressure is within the normal limits according to the guidelines. The fourth one is the diabetes mellitus. Diabetes is nowadays, according to the American College of Cardiology, if you have diabetes, you assume that you have ischemic heart disease. You have to be treated as if you have a coronary artery disease. In doing so, you may prevent to have a heart attack and ultimately myocardial infarction. Now, the other thing is obesity, as I've talked to, that the sleep apneas, they are the people who have a habit of snoring at night. And the snore is the first symptoms of a sleep apnea. And if you have a sleep apnea, ultimately down the road, it is going to affect your heart. So it has to be taken care of. So these are all the risk factors that needs to be taken care of such that you reduce your cholesterol. Now, you also have to know that we have to be very proactive now. As the last one, but not the least, is the genetic. If you have a genetic history that if your father or your mother had a heart attack or heart stents or anything before the age of 55, then you know one thing, you are prone to develop that problem, and you have to be extremely proactive, that you have to go to get yourself checked. And the most important thing nowadays, we have so many tools and modalities that we can detect this. And the most important thing now that is very in vogue is the CT coronary calcium score. The CT coronary calcium score will determine that are you starting to deposit this material in your coronary artery. The most important artery is the left main artery, and then after that is a Widowmaker artery, that is the proximal LAD. The beginning of the left introducing artery, if it's blocked, once you put a stent in there, the flow becomes good and you are fine. It's what we need to detect that in. With the CT coronary calcium score, it will detect whether you do or you do not have a problem. In that way, you can be aggressive. And then, once you know that there's so many people say, no, I don't want to take medications, I'm going to do myself, I'm going to exercise. How much can you do is also very important. If you cannot control your LDL, if you have risk factors, especially diabetes, and if your LDL, the bad cholesterol, is above certain number, nowadays we are even aggressive, we do not want the number to be more than 70. If you have diabetes, and if your LDL is like 70, you need to work more to bring it down, And there's so many other medication, a combination pill that will be able to bring it down, So this is in short, but we'll discuss, if there's any question, then you can always discuss after this thing. But Muhammadun Ali Muhammad Salawat.
Ibrahim, uncle, thank you very much for sharing the cardiologist perspective on preventative healthcare, and it was good to hear from you. So I'd like to move on to Dr. Hina Zaidi. Dr. Hina Zaidi, thank you so much for joining us today. If you don't mind, a small introduction of what you do and the gastroenterology perspective on preventative healthcare, and I'm sure you'll address everyone's favorite, the dreaded colonoscopy. So if you'd like to begin.
Assalamu alaikum, everyone. My name is Hina Zaidi. I'm a gastroenterologist. I practice in Long Island, fairly close to here. My practice is pretty wide ranging. I see patients with digestive diseases. I also see patients with liver, bile duct, pancreas issues. But the one screening test, since we're talking about preventative medicine here, it is the colonoscopy that I'll be talking about today. Colonoscopies are very important. When we look at cancer in this country, number one cancer is breast cancer. So I implore the women in the audience to always remember that mammography is super important. I tell every single one of my patients that I see for a screening colonoscopy that they must do a screening mammography as well. Number two cancer in this country is lung cancer, which is often related to smoking. So smoking cessation is really the way to reduce the risk factor there. Prostate cancer is significant for men, but number three cancer across men and women in this country is colon cancer. This is something that many people don't realize how frequent it is or how common it is. When we look at these numbers, you're looking at America, you think, well, this is not really my genetics, this is not my. So I'll tell you, I'm a Pakistani woman, and when I look at the statistics for Pakistan, colon cancer is the third most common cancer in Pakistan as well. And I can't imagine what the real stats are because unfortunately the numbers are often underreported and not accurate, but it is something that we do face in our community as well. Okay, sorry, I have a couple notes, so I'm going to refer to that as I speak so I don't miss any important points. Colon cancer screening is really, the advantage with colon cancer is that it starts with something small called a polyp, which takes many years to become cancerous. So as gastroenterologists, we take advantage of that very long period of time, which is years actually, to find patients who have no symptoms of anything, are completely in good health, and do a screening colonoscopy. We hope to detect the cancer before it becomes a cancer, and while it's still a precancerous polyp. At that point, it's something very simple to handle. We can easily remove it during the colonoscopy. And by removing it, basically significantly reduce, if not eliminate, a patient's risk of actually developing colon cancer. We know it works. We know it works because in this country, in the population that's been screened, the incidence of colon cancer has been reduced significantly. So a few years ago, they decreased the age to 45 because we found that 45 to 50-year-olds who were previously not screened for colon cancer were developing colon cancer at higher rates. And the 50 plus who had been screened did not have this problem as much. So we know colon cancer screening works. It's just that getting the patients to it is always been the challenge. Okay. Just to give you some basic numbers, 45 is the age at which patients need to start colon cancer screening. That age is less for people with a family member. Okay. And how often you need to be screened really depends on the results of your colonoscopy. It could be as long as 10 years and it could be as short as 1 year. I have a group of patients who have familial colon cancer. I see them once a year for a colonoscopy. I have another cohort I see every 3 to 5 years, and then the majority 7 to 10 years. Okay. I'm going to spend the last couple minutes talking about why people don't get a colonoscopy, the misconceptions of it. Okay. The first thing is that it's uncomfortable. There are probably amongst the crowd here some people who've had a colonoscopy in the last few years, and they can attest to it. A colonoscopy is not meant to be painful. You should not have pain before the procedure, during the procedure, or after the procedure in an ideal setting, and that's how most procedures go. The preparation is difficult. I tell every single patient that. It's something that I know every one of you can get through, but it's not anybody's idea of a fun day. There are now tablets available to do the preparation, which is a huge change from what the liquid that we patients used to have to drink years ago. So there is some improvement, but the preparation is challenging. The procedure itself is not painful, nor is it uncomfortable. Okay. Number two, it's an invasive thing. Listen, I get it. It is, of all the screening procedures we tell patients to get through, it is by far the most invasive. And to that end, it is also the best way to screen for colon cancer. If you don't think you could do it, there are alternatives. That's the other really important thing to know, is that there are other screening tests available for colon cancer that are not a colonoscopy. They are not as good as a colonoscopy, but they definitely are better than doing nothing. So Cologuard, FIT testing, and I could talk separately about those less invasive methods. Sometimes our mindset is we think all or nothing. Either I've got to do a colonoscopy or I'm going to do nothing. Well, do something. Do a FIT test, do a Cologuard, ideally do a colonoscopy. Okay? And finally, there's really no excuse at this point. There, as you could tell, there's women around to do colonoscopies. There are men. They're every age group. You really, need to be proactive about your health in this way. And the other couple of things I always hear from patients is, it doesn't run in my family. Well, it doesn't run in 95% of patients' families who get colon cancer. Hereditary colon cancer is not common. So the fact that you don't have a family member afflicted with colon cancer is, alhamdulillah, a good thing, but it does not change your risk of colon cancer, what we see in the average population. And then another thing I'll sometimes hear is that, well, I don't have any symptoms. Well, there are no symptoms of colon cancer when it's at a polyp stage, at an advanced adenoma stage, at its even early stage. Yes, the symptoms eventually are a change in bowel habits, blood in the stool, bloating and discomfort, but we don't want any patients to wait for that, because at that point you don't need me any longer. You need a surgeon and an oncologist and many more invasive treatments. So really the take-home point here is, it's not an easy test to get through, perhaps, but it is an extremely important one, and we as a community are just as much at risk as anybody else in this country. So don't think that, I eat very healthy, I'm from a different place. None of those actually pan out to be real risk reducers here. Okay. Anyway, I'm available afterwards, inshallah, for any questions that anybody might have.
Yes.
How many percentage of side effects of this going through this procedure?
Yeah. So there are several bad things that can happen after a colonoscopy. I told you about all the good things. The bad things is, if somebody has a very large polyp that we have to remove, we essentially cut the polyp out of the colon and therefore leave an ulcer behind. That ulcer can bleed. But guess what? You also don't have that polyp that was there before that could have turned into cancer. Bleeding is a known side effect of a colonoscopy that is very easily managed by a gastroenterologist. So I don't consider that a true complication. The real complication here is a perforation, which is an unintended hole or a puncture in the colon that requires a surgery to fix that problem. That happens to one patient out of 1,000 to 2,000 colonoscopies. In the practice I'm at, we do about 50 procedures a day, and alhamdulillah, this past year I haven't heard of a single practitioner having it. Just to give you a sense. Does it happen? Absolutely. Have I heard of it? Absolutely. It is extremely, extremely uncommon. This year alone, I probably had 5 to 10 colon cancers on first-time colonoscopies. That's 5 to 10 people who didn't know they had colon cancer, walked into office and had a colonoscopy and found out about it. 0 perforations. So just to give you a perspective of how often these things happen.
Thank you, Dr. Zaidi. Thank you very much for your advice from a gastroenterologist perspective. Brother Imran, good to see you again. As we all know, nutrition and health go hand in hand, so please share with us the nutritional perspective on preventative health care. Here, you can take this.
Thank you. Thank you. Sorry about that. Thank you. I'll do both? No. Can everyone hear me? Yes, okay, good. Assalamu alaikum, everyone. My name is Imran Sayed, and I've worked in the nutritional field almost going on 2 decades, so I'm pretty old. But nonetheless, working in the field of nutrition in the United States of America is very challenging, and it's not to knock on fellow doctors and everything, but preventative medicine and preventative care was not really something very popular 20 years ago. And because, you know, everyone is young, a lot of concerns weren't there for preventative care. But as more and more knowledge is being we're in the age of information, internet is available, aunties are going to YouTube and you're getting the full information on all these, homeopathic remedies, and uncles are basically, sending all these nice Islamic videos to the younger people. So, alhamdulillah, it's a great resource, but also there's a lot of information now that's circulating on health and everything and nutrition, and it's a lot of information. And sometimes it could be also misinformation as well. So one of the things that's very important when it comes to nutrition and health and preventative care, number one, pretty much the most basics. Starting off with the most basics, we usually get wrong. If you can fix the basics, then you can build on the basics. And what are the basics? So some of the things in terms of health and overall health and metabolism, in terms of how you digest food and everything, sleep, number one. Sleep is very important. Getting adequate amount of sleep is very important. A lot of studies are showing that there is definitely metabolism is linked to sleep schedule. Also the timing of your sleep. If there are any, if you had a history of working night shifts or working late shifts, that too can affect metabolism and can affect in terms of weight management, even weight gain. So sleep, if you can sleep throughout the normal hours, syncing with the sun, because Allah has created such an amazing system, we are pretty much in sync with the sun. So when the sun comes up, the light hits our eyes, it sends messages to the brain to start waking up, metabolism goes up, and then you're ready to eat throughout the day. Your breakfast, because you're fasting the whole night, and then lunch, and then when the sun is going down towards Maghrib time, then that's when the metabolism goes a little bit slower. But we have a problem of eating nice hearty foods at dinner time, and then not moving around. Now your stomach is full of all of this fuel, you have all this energy, but you're not using it. What do? Relax, sit down, gupshup, chai, biscuit, drama, and then that's it, right? But the reality of the thing is that, and this is a common lifestyle, what's very important and we lose sight of is in terms of the lifestyle, right? Lifestyle is very important. Rather, it would be better, in some countries, what they do is they would have a big breakfast, a huge lunch, and they would have soup for dinner. And that's it. And then a very light dinner and able to sleep pretty much throughout the brunt of your day. That's when you need fuel the most. But we get distracted with work, we're so engrossed in our work, we don't have time to eat lunch. This is pretty much Majority of my patients I've been seeing, this is the American lifestyle. It's unfortunate. Well, let's say New York. I mean, other states are probably a little bit easier, but when it comes to New York lifestyle, this is very common. And that's one of the things that, it's in terms of preventative measures, controlling calories is very important. Yes, dinner is pretty much the most comfortable time in all of our day, in terms of working hard throughout the day, and you want to relax in the evening, be a little distracted here and there, enjoy a little sweets or something, and then that's it, call it a night. But that repeated over a period of days, and then weeks, and then months, and then you wonder, where did this weight come from? Why am I pre-diabetic? Why am I having, slight, blood pressures being affected? So everything is connected. Everything is all connected. There is nothing that is separate from each other. So what's very important is a lifestyle improvement is very good. A lot of these things are where you can make a change in your lifestyle overall. So when it comes to, even like I mentioned, I'm not even going to go into details of calories or food, but portion sizes, if you can get the portion sizes correct, knowing, we usually have a habit of eating in large portion sizes and everything, just know when to stop eating when you're comfortable. Allah told us that leaving 1/3 of your stomach empty, at least, or is it 1/2? 1/3, all right. So 1/3 of your stomach empty to breathe. So if you're having a hard time breathing after dinner, well, I guess, there is a problem. So just follow that simple rule Allah tells us. And if you could do that, at least for dinner time, enjoy your breakfast, enjoy your lunch, bring your dinner portion sizes down, leave some errands for after dinner so you're constantly moving for 1 hour, and then you can relax. Something like that. And it's very interesting. Everything my parents have told me, my grandparents have told me, have been proven scientifically. This is crazy. Even when they say, probably we always hear that after dinner go for a walk. It's like, well, a walk's not going to do anything. Great. A study from Japan comes that 45 minutes after eating dinner has proven basically more efficient metabolism and digestion of food. Look at that. So a lot of the things that we're told by our grandparents, parents, and everything actually has some merit, and it's through practical observation. So overall, like I said, the basics, when it comes to overall lifestyle is very important. That too will help and contribute in preventative measures. All right, thank you.
Thank you, Brother Zaidi. And I know for Thanksgiving, I did not keep 1/3 of my stomach empty, but from now on, for sure. So thank you, Brother Imran. Dr. Mukhi, thank you very much for joining us today. Again, a small introduction of yourself. And from an internal medicine perspective, what is your advice on this topic?
Assalamu alaikum, everyone. Assalamu alaikum. So my name is Sakina Mukhi Dinani, and I'm an internal medicine physician. And what that means is I take care of 18 and over. So it's great to know the cardiology preventative measures and the gastroenterology and from infectious disease and nutrition, but I know the one thing that everybody has a question about is, well, how do I get there? How do I know I'm supposed to go see the cardiologist? How do I know at 45 I'm supposed to get a colonoscopy? Well, that's my job. And each and every one of you, the most important preventative measure you can take is going for an annual wellness physical. And the key word is 2 words, annual, once a year, and wellness. It's not, my pag dukeche or my leg hurts, I'm going. No, you are feeling well. So when you have this evaluation with a doctor, an internal medicine physician, when you are well, I get a snapshot of what you really are. I can hear your lungs and listen to your heart when you are well. I can take blood from you when you are well, so I know what your cholesterol is. I know what your diabetes screening numbers. Are you pre-diabetic? Are you diabetic? So this one visit, when you're feeling well, so you actually have to make time and say, I'm feeling good and I should see my doctor. Usually I tell my patients, please schedule it around your birthday so that you don't forget. And this is a free visit. This visit is covered by your insurance. So you go and you tell the doctor and they ask you all these questions. And then you're like, why does they need to know this? Why do they need to know when my dad had a heart attack? Why do they need to know who in my dad's chacha's son's brother has cancer? Because you are a makeup of not only your family's past, but your past as well. So it's important to know where your family genetics are, But it's also important to know what you are doing about it. So I'm going to give you a prime example. If you look at me, and I'm going to get a little personal, most people would look at me, and you guys have known me for years. Sakina's healthy, right? Patrice, she's skinny, she's active, she's always all over the place. What if I were to tell you, today I am 40 years old, 2 years ago I was diagnosed with prediabetes. I do not process sugar the way, let's say, Arifba does. So, I wouldn't have known that unless I went to the doctor and did my blood work. And yes, I'm a doctor, but I go to a doctor. So when I turned 38 and they did my blood work, and I was doing everything. I was exercising, I was eating a typical diet that I normally was, and I was diagnosed as pre-diabetic. And what that means is that if I don't take care and I don't make changes, I will end up being a diabetic. So it's not what you look like or how you feel. It's what you're on a base already are at. So when you go to the doctor and you do this annual wellness visit, we get a snapshot of who you are. So let's say you went in 2019, you went in 2020, you went in 2021, and you're going every year. So Dr. Zaidi said you need to go for a colonoscopy, right? So what if I did your blood work, and in 2019, your blood levels were good. They were high. They were on the high end of normal. But then 3 years later, I see you're at the low end of normal. Now, it's still normal. But because I know you, and you've been consistently coming to me, and I have a base of comparison, that kind of raises a red flag to me. That, oh, why are you losing blood? It's still normal, because this range of normal is this huge bell curve. But we have to find out where you fall on this bell curve. So when you go to when you go for your annual wellness, we find out where your normal is. So now this blood level is falling, and you've never been this low. It's still normal. It still triggers me to call her and say, hey, this person's blood level has dropped 2 units over the past 2 years, and I have no clue why. And she'll take the consult. So what your primary care doctor's job is to know you well based on all of these annual wellnesses, that we direct you. Oh, you know, your cholesterol's a little high, your blood pressure's a little borderline. Please, by all means, go see Dr. Isa. You know, you're pre-diabetic, your insurance covers a nutrition consult. Please call Brother Imran. Oh, you're due for a flu shot. Make sure you go to CVS and get your flu shot. You're not due for a colonoscopy, but your mom was diagnosed with colon cancer at the age of 35. You're 35. You need to go. So that is the most important preventative wellness, because I can't expect all of you to remember, hi, at 40 I go for a breast exam, a mammogram. At 45 I go for a colonoscopy. At 65 I was a smoker. I need an abdominal ultrasound to make sure I don't have a AAA. That's my job. My job is to be your quarterback. My job is to make sure that you are the best player in your game of life. So how many people go for an annual wellness exam? How many people have a primary care doctor? Everyone, from the time you are born, should have a primary care doctor. Under 17, we call that a pediatrician. Over 18, we call that an internist or a family practitioner. For example, Dr. Ruhaina Mukidarsi, she is a family practitioner. So whereas I can only see patients that are 18 and older, she can see children and she can see adults. And that's amazing, because she can see where, let's say you're 12 years old and you get diagnosed with high cholesterol, she's still taking care of you when you're in your 20s. So she has the best idea of who you are. So it's important to do this annual wellness, and it's important to do it with the same doctor, or at least obtain your records if you move, so that they have a baseline comparison. So, and then the other important thing is, and I'm not a pediatrician, but I thought it was very, very important, because I think the most important thing any of us doctors can do, and this is something that marhum Dr. Shakir Muki had instilled in us, is your community comes first. And I think that's why me and Ruhaina became primary care doctors. So as children, they're supposed to hit certain developmental milestones. And I am not a pediatrician, I am not a family practitioner, but I lived through this. So it is very, very important to take your children to their annual wellness exams and make sure you are talking to the doctors and answering their questions. How many words are they saying? Are they walking on time? And this old thing about, don't worry, he didn't, my son didn't walk till he was 4 either. Tell your doctors everything. They need to see the kids more than once a year. The same way we need to see a doctor once a year, your children need to see a doctor once a year as well. And then importantly is, even if you do not have insurance, children in the United States, whether you're legal, resident, citizen, they automatically qualify for insurance. So if you have any issues getting your children insurance, please speak to Brother Roshan. And if you yourself are over the age of 18 and need insurance, or you need to get these things done, please reach out to me, reach out to Reina. We are more than happy to connect you with resources where either it's low cost or even free. But there are programs that you can get your colonoscopies covered, your flu shots, your mandatory vaccinations, cardiovascular testing if it's necessary. So there are ways to get the coverage you need. And then there's a whole slew of preventative tests that you can do that are above and beyond what your insurance covers. So I'll give you an example. Ibrahim Ba mentioned the coronary artery calcium score. This is a CAT scan, 20-minute test. Put you in a machine, give you some IV dye, take a picture of your heart, and it says, oh look, you have a blockage on this artery. You don't have a blockage. You have a blockage here. It is a 20-minute test. And if insurance does not cover it, how much do you think this test is? Throw out some numbers. 200? It is anywhere between $89 to $99. That is cheaper than a night out at guac time. So what I'm saying is, please, we are a resource for you. And we have gone into this field not only to help humanity, but to help our community first. So there is no stupid question, there is no dumb question. Please ask us, and if you're having trouble getting these resources, we are more than happy to help.
Thank you. Thank you very much, Dr. Mukhi. I appreciate it. And last but not least, Brother Arif, if you can do the same, a small introduction, and then your perspective on preventative healthcare, especially with COVID and flu coming up, and if you can try your best to keep it brief, because then we have namaz time. Yeah. So sorry about it. No, it's okay. Bismillah.
Assalamu alaikum everyone. I'm Arif. I'm sure you guys know me from the previous talks that I've done. I'll be real brief because I'm holding you up between you and namaz, and we don't want to do that. So I wanted to talk, since we're talking about prevention, I wanted to talk a little bit about vaccinations. So vaccination is a way that we can kind of prevent your body from getting severe diseases or not. We all get vaccinations as kids. You know, we can't go into school without it, and it's all about prevention. But a lot of times, you know, we fail to recognize that even in adulthood, sometimes our immunity wanes and we need to get either like a booster or other vaccines that are needed later on in life. So there'll be a handout going around. I just wanted to talk about it briefly. I'll talk about a few topics, a few vaccines that you guys should talk to your practitioners about. And then I'll be available for questions if you guys more specifics on it. Firstly, the flu vaccine. So the flu vaccine you should get every year. It is for everyone who is 6 months and older. A caveat is anybody who's above 65 should probably get something called the double dose vaccine, which is the higher amount of antigen in the vaccine itself. And that's approved for anybody that's 65 and older. In certain situations, like patients with heart disease, patients with severe lung disease, patients with severe liver disease, it can be approved in even that age group that is younger. So patients who have certain risk factors, that can also be a potential that you can get. Next, you know, and you guys should get it around October, November time, because it takes about a few weeks to get immunity in you, about 2 weeks or so. So definitely those of you who haven't gotten it done today, please go and get it done today. Secondly, also in the winter time, we know that the COVID numbers usually go up. Most of you guys probably got your regular COVID vaccines. As far as the CDC recommends getting a booster as well. So the booster, similar to how the flu vaccines, because the strain changes every year, we know that the COVID strain changes slightly every year. So the newer vaccine targets this particular strain. Especially, you know, if you don't want to get it, if you're younger, fine, I understand. If you're 35 years old and you don't want to get it, I understand that part. But anybody who's 65 and older should definitely get the COVID booster, because in the winter time when the numbers go up, then usually that's where we see hospitalizations, you know, patients with severe respiratory issues. And thirdly, the new vaccine called the RSV vaccine just came out like last year. It's a very important vaccine. RSV affects the two extremes of life, so very, very young and very, very old, and certain patients with same lung disease, heart disease, diabetes, liver disease. Those are the patients at increased risk. Also, patients who are in facilities like assisted living and nursing homes, those are at higher risk because RSV tends to spread very fast. If one or two people have it, next thing you know, the whole floor has it. So it's very important. It's a relatively new vaccine. It's approved for anybody who is 75 and older, if you have no risk factors. If you're 65 plus risk factors like heart disease, lung disease, liver disease, then you can get it done as well. Or patients with severe immune problems. So patients who have had chemotherapy or leukemia or anything like that, that's also approved for you. Fourthly, shingles vaccine. I cannot harp on this enough. You know, I've had a few community members come to me and have had shingles. It is extremely, extremely painful. You guys will get over the rash, but usually the afterwards, the neuralgia tends to be extremely painful. The newer shingles vaccine is extremely effective. It's over 90% effective at both preventing the rash as well as decreasing the incidence of something called post-herpetic neuralgia, which means it hurts after the vaccine, basically hurts after getting shingles. You get nerve pain, and it can be extremely debilitating. So this vaccine is a newer vaccine. It's a series of 2 shots, can be given 6 months apart, approved for anybody 50 and older, or certain risk factors. So if patients are on chemotherapy or transplant patients, you can get the vaccine when you're younger. Otherwise, it's approved for 50 and above, 2 shots about 2 to 6 months apart. All right? Pneumonia vaccine, real quick. I'm going real fast here so you guys can ask me questions later. The pneumonia vaccine won't prevent you against all types of pneumonia. It's just specifically to something called pneumococcus, which is streptococcus. It's usually the most common cause of pneumonia, bacterial pneumonia in the United States and worldwide. The newer vaccines eliminate the need for 2 shots. So we all get vaccinated with these when we were kids. You get a series of 4 shots before you are age 2, actually. But then later on in life, the immunity tends to wane. Previously, there was a vaccine that you would take at age 50 and then get boosted like a year later. With the newer vaccine called Prevnar, or PCV21 or PCV20, that eliminates the need for that. I can go into the specifics with you guys later if you guys want to ask me any particular questions, but that will eliminate the need. Basically, it does not eliminate the need for a flu vaccine because you can still get flu, and this is a bacterial infection. I think lastly, also getting tetanus shot, something called Tdap. So Tdap, we all get, once again, when we're younger, when we're an adolescent, usually when you're 12 years old, you would get vaccinated against that. Well, a lot of people, but then we don't remember to get a booster later on in life. You'll only get it, like for example, if you cut yourself and go to the emergency room, then they'll give you a booster there. Anyone who is pregnant should get it in their 3rd trimester of pregnancy. The reason for that is that that passes what we call passive immunity down to the fetus. You know, the P part of Tdap is basically pertussis. You guys may have heard in the news that last month, right before Thanksgiving, the CDC reported that the number of whooping cough, which is what pertussis causes, was highest that they've ever had before. So the disease is still there, and this is very, very, very preventable. So anybody who is in the 3rd trimester of pregnancy should get the Tdap. Any grandparents taking care of their kids should also get it because this way they're not passing it down when they're taking care, especially caregivers. All right? And then anybody reasonably above 50 should get boosted against it in case you cut yourself. Also will prevent you against getting like pertussis and whooping cough. All right? I have some other vaccines on the sheet that you guys can talk to me about, like hepatitis A for people who are traveling, hepatitis B for people who work in the healthcare field, and other meningitis shots that you guys can also ask me about. But really the whole point of it is to get ahead of it, so this way it's not causing a problem later on. Because if you get the disease, it's much worse than the side effects of the shots. All right?
Yeah. Thank you so much, Brother R. Can we have one loud Nara Salawat for all of our panelists? For this? Thank you. So, well, it's about to be namaz time right now. It is namaz time, so we'll break for namaz. But if you have any extra questions or personal questions that you'd like to ask any of our panelists after namaz, you can approach them. They'll be around the booths. So, yes. 5 minutes of questions? Oh, okay, okay. Okay, so we'll take any extra questions from the floor, if there are any. Any questions? Yeah, yes.
I just have a suggestion. When we have, would you like to come up to use the mic? So I
Yeah. Thank you.
This is what I have found, and it has been very helpful. And that is that, when you're eating, you eat less, of course, and leave some stuff that is, you go for a walk around the kitchen, maybe. But I found out that when you come back again, you've lost that appetite to eat again. So when you eat that little bit, it helps a lot. That's what I found out. And the other thing is that for annual checkups and everything, I think the doctors have to send reminders to their patients that you're due for this exam, you're due for this exam, and I think that helps a lot. Because even when you do the thing and you set up a thing and set up the appointment, the phones now give you a reminder that, okay, you're due for this test and you're due for that. But I think the doctors can set up so that the patient knows that he has to come back again, right? Yes, yes. So I just thought, yeah. I'm with NYU, so I know you go on my chart and you do all that stuff. So it's very helpful.
Your insurance sends you a reminder too. Or
Thank
you have not established care with a doctor, or you're due for your annual, you haven't refilled your meds. Your insurance does send you reminders as well. Bingo.
Perfect. Thank you very much. Is there any other questions? Yes?
How do we avoid all these chemicals that you're suggesting? What about alternative? So, there's been a lot of theory about like alternatives and stuff like that, but these vaccines have been proven to be very, very helpful. So, for example, measles is a big problem. So people who are not getting vaccinated against measles now, we're seeing a recurrence of measles. Same thing, polio. We had pretty much eliminated polio until this movement of anti-vaxxers came in, and now people are worried about, I don't want to give my kid this, I don't want to give my kid that, and now we're seeing a recurrence of polio as well. Yes, the cases are very low, but in developing countries, the rate of polio has actually gone up now. So I understand the hesitancy for not giving certain things, but these vaccines have been proven to be very, very effective. So I mean, ultimately it's a personal choice whether you want it in or not. But some people can get what we call active immunity, right? So if you get chickenpox, for example, when you were younger, right, you would have immunity against chickenpox when you're older. But that's not true for all diseases. Like if you get measles when you're younger, you're gonna be in very bad shape later on in life, kind of thing.
I'm not talking about the past medicines that we were all given. Now we've come to a new height of technology where you guys are coming up with, well, not you, forgive me, coming up with these new chemicals, right? What has COVID done to us? The COVID medication, the effects of it?
I would say that it was very effective in preventing hospitalizations and mortality. But I understand that the concern was that some people reacted not well to it. And actually with COVID, they've taken out a new vaccine for patients who are concerned about taking an mRNA vaccine. People are concerned about the technology, but it's been used. But now there's Novavax, which actually is a protein-based, which is old technology that we're using from back in the day, with the same pneumonia vaccine, with the influenza vaccine and everything like that. So there are alternatives that are there. If you want to, I know you specifically may be referring to COVID because that was a newer technology when it first came out, but now there are vaccines available where they're using protein technology to basically stimulate the antigen, basically.
Thank you very much, Brother Arif.
Yeah.
Yes. So just one more quick note, and then we'll go for a namaz, inshallah.
Assalamu alaikum. I just want to add. Oh, I'm sorry. Somebody saying.
Go ahead.
Okay. I'm sorry. I'm sure most of you know this, but I just wanted to add here, like Dr. Sakina Mukhi said about the insurance part. I just want to let you know that a lot of people have come to me and said, "Oh, my paase insurance nathi, hun su karu." But I'm just letting you know that in any case, if you are sick, you just go to the emergency room, because in 1996 the federal government had an act which is called EMTALA. It's Emergency Medical Prevention and Labor Act. So just go to the emergency room and anywhere, and you can start your care from there, because then you have like social workers and case management who can help you to get like Medicaid and stuff. So don't just sit at home. I know the home medications and home medicine helps a lot, herbal medication, but I think it's very good that you go to the emergency room and start your care there, because I know we have like immigrants coming in and they're always worried about, oh, I don't have insurance. So don't be afraid, just go there because it is covered. Nobody from the emergency will turn you down. Thank you.
Thank you very much, sir. Sallu ala Muhammad wa ali Muhammad. Wow. Okay, yeah, sure.
So we have a couple of raffle prizes. We want to thank everyone who registered ahead of time. And if you registered ahead of time, we have your name in this little bag. And inshallah, we're going to be giving out a heated blanket for the winter time. Dr. Ibrahim, can you pick the winner? And this is all for people who registered early, on time.
Here we go. Here we go. Let's see.
Mawish Zara, she just went to go pray, I think, on the other side. Okay, and we have two more that we're going to pull out really quick. It's going to be for the affirmation cards, and we have resistance bands.
Okay.
You want to give to Imran? And this is for everybody that entered the front door. We put your name on the raffle.
Okay. Oh, there we go. Fatima Ratan.
Oh, Fatima Ratansi. You get affirmation cards. We'll give it to you in a bit. And the third one is for resistance bands. This is going to be really good for your PT and OT.
Okay, she's the lucky one, so she's drawing. Let's see. Let's see.
I'm trying not to. Natasha Bobby.
Natasha, you win resistance bands. Okay, perfect. So now everyone can.
Okay, yes. So now we will be reciting Jamaat Namaz in this hall. So the men will be in the front, the ladies in the back. If you need a chair, we will help you and bring the table to you. If you're able to pray on the floor, then we'll just make space on the side. We're just doing the best we can because in the other hall we have the career fair setting up at the moment. Okay. And after namaz, Ali Jawad is reminding you, please come back. We have 2 more sessions. Do not leave.
Sallu ala Muhammad wa ali Muhammad.
Yeah. إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمد رسول الله أشهد أن محمد رسول الله أشهد أن أمير المؤمنين وإمام المتقين عليا ولي الله أشهد أن عليا حجة الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح حي على خير العمل حي على خير العمل الله أكبر الله أكبر لا إله إلا الله لا إله إلا الله وصلى الله على سيدنا محمد وعلى أهل بيته الطيبين الطاهرين.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Assalamu alaikum, brothers and sisters. We're going to recite Jamaat Salat. I'm told that there is nobody else to lead Jamaat Salat, so I've been asked to lead Jamaat Salat. It is better for somebody who is a local to read Jamaat Salat, because that way you have a full
Assalamu alaikum. We have some announcements about Medicare as you're getting settled. So you can give your attention to Brother Roshan, and he's going to tell you a little bit about Medicaid.
Assalamu alaikum. My name is Roshan, and here is Nancy is with me. We are partners. So we do.
Sallu ala Muhammad wa ali Muhammad.
So we do health insurance for last 7 years. If you have guys any kind of Medicare Part A, B or Medicaid, if you guys need any help for somebody is taking care of you, it's called home care, or we do have adult daycare at East Meadow with Feroz Mukhi and Fatima Mukhi. So when you face any challenges to find out the right insurance, including Medigap policies, is called the Medicare supplement, or if you need that health insurance for any carriers, we are independent agents working under Department of Financial Service. So once in a while, maybe you have some questions about why I am getting so much copay. So there we will help you to find out the specialist, the PCP, and your drugs. That's your medication list. That we will check out with all 27 carriers. We are directly contracted and carrier authorized. So we will check out and find out, give the right solution for you. So we do need some information that Nancy is going to taking care of that part. Nancy, please.
Assalamu alaikum. My name is Nancy. As he said, if you have any questions with any insurance, you can always come to us. We have a table right there as medical insurance. So the information that we need is your ID, your Medicare, if you have Part A and B. If you have any difficulty in finding the insurance, you can come, we can put it in our system and we can find it out for you. And if any additional extra benefit that we can help you to get it, we will help you to get it too. So we are opening an adult daycare also in East Meadow Avenue. I'm just letting you know for all the adults who are needed, the adults socially and yeah, in 4 to 5 hours you will be having some extra activities like singing and some activities within all our community. So main guy is Feroz Mukhi, as you know. So and Fatima Mukhi is also a part of that. So the address is 574 East Meadow Avenue, East Meadow. I think in the evening we have a gathering over there. So we have we're gonna meet over there too. We will be there also. So if you have any doubts with any insurance, come to us. We're gonna help you. Thank you.
And one more thing I forgot, sorry for that. And we do the OPWD case. The kids have the autism, the physiotherapy, occupational therapy, speech therapy, and we do taking care of that too. Okay, thank you so much.
Thank you so much for sharing that wonderful information. Okay, we will give you 30 seconds to settle down so we can begin this panel. I'm so sorry for rushing everyone, but we want to stick on schedule and we have some amazing programming this afternoon. So we just want to make sure that everyone can take advantage of everything. So you're down to 20 seconds now. Okay, and one other note that I've just been told to announce is that when you go to these booths and speak to the professionals, understand that your conversations are confidential. We have rooms available in the back if you have to have a more private conversation, and you do not have to worry about any of your information. These are all professionals and they abide by HIPAA, and all of your information that you share will be confidential, so you can trust the advice that you are given.
Thank you, Shazan. Just a quick announcement, Mominian. Can I have everybody's attention, please? Can I please have everybody's attention? Can I please have everybody's attention? So please, everyone gathered, I would like to make a request that when the panelists are in conversation, I humbly, respectfully ask if you can keep the conversations on the side to a minimum, because there's a lot of disturbance that goes on, and these are sessions that are extremely important, and of course everything else going on around us is very important, but please be mindful of your voices. Salawat.
Okay, so I think those that have made it to their seats are there, and we're going to get started. So thank you for joining us for this panel. Again, the title of this panel is Voices of Care, Perspectives on Aging. For this panel, we plan to explore one of the most pressing and deeply personal issues affecting individuals, families, and the community: aging and the support systems that accompany it. As our population continues to age, we have incredible opportunities as well as significant challenges. This conversation is not just about the experience of aging. It's also about the role of caregivers and how we as a community can ensure that our older adults are not only cared for, but empowered to lead fulfilling and dignified lives. Our panel today brings together a diverse group with expertise and rich lived experiences. Though we'll start off with questions from the front, this is meant to be an interactive conversation on a topic that's important to all of us. So please feel that this is a safe space, and please feel free to chime in with your experiences as well. To begin, I'll give an opportunity to our panelists to share their expertise specifically as it pertains to this panel. So please, keeping it to about 2 minutes, just share why you are on the panel. I'll start with Sister Sheila.
Assalamu alaikum, everyone. My name is Sheila Darcy, and I was lucky enough to be the caregiver for my parents, and alhamdulillah, I still are caregiving for my mother-in-law. So
closer to your face so they can hear you.
Oh, really? Okay, now you can hear me? Okay. So, alhamdulillah, again, I was very blessed to take care of both my parents, and they are no more. But alhamdulillah, I still get a chance to take care of my mother-in-law. And, it's pleasurable, and it's really rewarding. But I guess we'll talk about it later, everything, yeah.
Thank you, Sister Sheila. Dr. Imama, you can go next and explain specifically why you're here for this panel.
Assalamu alaikum, everyone. Thank you for coming, and I hope that I'm able to be helpful today at the panel. So my professional expertise is as a neurologist, so I specialize in brain conditions, diseases, specifically stroke, and the neurodegenerative conditions and disabilities that come with that. That also means the caregiver stress and burden that I see people experience every day with their loved ones as they come to see me in clinic or as they're in the hospital. My sister is a palliative care and expert, and also a geriatrician. So just hearing from her and listening to her experience is also helpful. My brother's a psychiatrist, and so listening to the things that he tells us about and the caregivers that he has experience with in terms of mental health, and all of that comes together in terms of the complexity of conditions that caregivers have to deal with, and hopefully I can be helpful in terms of your questions today.
Hello. Assalamu alaikum. I'm Ali Madad. I think like everyone here, I spent some time caring for my parents. I've spent 7 years caring for my father and then my mother. They both passed. And after my mother most recently passed earlier this year is when I took that time to reflect on what that 7-year journey meant for me. And as is noted here, I'm listed also as an app designer, and what my kids call me is like, oh, Dad, can you show me your AI? I wanted to focus on some of the pain points that I experienced as a caregiver, and I made something that addressed that. So I have some information on that in the back, and it very specifically focuses on the unique journey that caregivers experience, which is fraught with isolation, emotional tension. Things that this app can address are the kind of financial burdens and things like that. So hope to have more conversation.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name's Akbar Mitani. My background is in geriatrics and geriatric medicine, and I've worked in that field for, I don't know, about 30 years or so. So I have a lot of patients that have family members that go through a very difficult journey when their loved ones are in a situation where they need support and they need help. So that is one thing. The other thing was that in my own life, having spent 30 years in the area of geriatric medicine and helping patients and their family members, I also personally had my mother who had dementia and a terminal illness, and I was the caregiver for my mother. And so that experience for her was very difficult for me, especially when it came to a point where I had to make a decision on whether I place my mother in a long-term care facility. And that was probably the toughest decision I've made in my life, is whether I place my mother in a long-term care facility. And my colleague, geriatrician, who was looking after my mother, was a lady. She said to me that you should have done this 2 years ago. You kept her with you too long. And so as I saw her in a long-term care facility, and I was trying to balance my own life and the life of my family members with a mother who was in long-term care facilities, where I had to consciously go and see her every day, twice a day. It had a huge impact on me and my family. And that particular journey is hopefully something that I hope to talk about today.
Thank you so much for sharing your experience with us. This first question is open to anyone on the panel. What role does family and community play in the treatment and care of elderly patients? Would anyone like to take a crack at that one? The role of family and community?
I mean, for...
Yeah.
Is that okay? Yeah. Family definitely plays a major role, especially siblings, spouses, even the community. They always helped. Sometimes they would bring, when I was taking care of my parents, they would come, sometimes bring food for them. They would say, hey, if you need anything, please let us know. So community was always there. Family, definitely, siblings, spouse, even the grandkids, they were always there to help out, especially when they were hospitalized. That's when we needed them the most, and they were always there, So family is definitely something that you need. And again, it's a balance, because you're trying to take care of your parents and you have your own family. So it becomes a little difficult sometimes, but you learn to balance. You try to do, the best thing I noticed was scheduling. If you have like a good schedule, a good routine, so you can balance yourself and help them and then help yourself. So definitely you need a balance in there. And I think these are the two things that I would say about it. Yeah.
Thank you. Ali, did you have something to add?
Yeah. The only other two things I would add is, as the primary caregiver with my two parents in the home, I had two sisters who were very active but remote, so communication was paramount. we digitally documented everything, we shared, and we distributed responsibilities and roles, defined them equitably in ways that we could all agree on. And I think that's really important to do that early and often and communicate, because we were dealing with both my mother and father at the same time, with one with ALS and one with dementia, and so it was pretty complicated. So again, I would echo again everything that we just heard and just add to that.
Anyone else? Dr. Mitani, you'd like to add on?
So I'm going to be a little bit controversial. In
Please,
what I'm going to
please,
say.
we're all waiting for that.
I think one of the things that families suffer from is guilt. And I think there is huge guilt, especially amongst the children of the parents that they are looking after. And I find sometimes that the children, the patients, the children of the patients that I see, find it very hard to forgive themselves because they have immense guilt. On the one hand, they feel that they're torn. They need to lead their own lives, and in looking after their loved ones, their loved elderly parents, it creates a lot of tension in the family. It creates a tension between the spouses. There is the mill-dill syndrome, right? The mother-in-law, daughter-in-law syndrome, right? There is, what I call the mill-dill syndrome. Many times, the son may be a little bit distanced from that caregiving part. Some of them, of course, are very, very involved. But I do find that it's important that unless you learn how to forgive yourself, you will not be able to look after your parents properly if they are going through a difficult time. And I think it's really important that you deal with that guilt that you have. And this is where I want to just, because we are in a community setting, I think it's really important that, and I say this respectfully, Hasnain Bhai, you're the president of this community, I really think it's important that you have a formalized community support system. You need a formalized community support system. Not just an ad hoc community support system. You need a group of people that are really, aware, with some professionals in there who can actually provide support to those family members, right? I gotta tell you, I know families in our communities who are so engrossed, so committed in looking after their elderly parents that they forget about looking after themselves. And they're torn, right? And it creates a huge issue amongst the family members, amongst the spouses. And sometimes if you have a family community support system that can just say to those young couple who's looking after their parents, you know what, you need to get out and go out on a date, right? Go out on a date, go watch a movie, go to dinner, go do something, and we got you, right? And if you can do things like that so that they can continue to build their own relationships, it's really critical. So that's just what I wanted to kind of say, that it's really important that you do not forget, to look after yourself before you look after your parents.
It's amazing, Dr. Mithani. I would be happy to volunteer if we want to start a community group. And I'll just say, factoids. We know that Alzheimer's dementia is the most common dementia. We also know that men tend to not survive as long as women. And that's specifically because of social isolation. So if we want our men to live longer with dementia, we should provide them support. And I will say that we've started a stroke support group for our local community. We're called the Stroke Warriors. But really what that's brought is a lot of people together from different professions and different patients, and everybody just shares their stories and everybody cries every time. So if we could do something like that for our own community, maybe once a month, just get our patients and their caregivers together just to talk about how the month has gone. That might be one easy way to initiate it, and I'd be happy to help, and we could do different activities and just make it fun.
You would like to add something?
At what stage do you find out that somebody has dementia in the family?
Would you like to repeat the question first so they can hear?
I think the question was, at what stage do you find out that someone in the family has dementia? The simplest way to answer that is the stage at which you are willing to acknowledge that somebody has dementia. It's a very abstract response, but it's encompassing. One of the first signs of dementia can be word finding difficulties. One of the first signs, I'm typically very loud. One of the first signs can be word finding difficulty. One of the first signs, depending on the type of dementia, can be visual-spatial disorientation, meaning I can't really tell what the time is anymore. Or not being able to be as receptive and responsive to our surrounding as we used to be. And those signs can be very subtle. A lot of times, most of us try to hide those signs. Again, it comes back to whether we are acknowledging that we may be having changes in how we process things, and our loved ones may not be willing to accept that it is time to bring attention to it. So the best time to acknowledge that we may be dealing with memory problems or cognitive processing or language problems or mood changes or personality changes is the moment that we're willing to acknowledge that something needs to be done.
Is it reversible?
No.
Dementia is not reversible. So let's be very clear about this. Dementia is a terminal illness. Okay? Dementia basically means that your brain is being eaten away. It's deteriorating. We don't have any medications right now to reverse dementia. We have medications that treat symptoms of dementia, but they don't slow down the disease or they don't halt the disease. Now, there are some recent advances, as I'm sure our neurologists will tell you, that there are some drugs that are now on the horizon, potentially biologics, that could have an effect on dementia, but right now their side effects are so significant that they are not widely available.
But if my understanding is that sometimes when you take prescription medication, that causes dementia or a temporary loss of memory or whatever.
Yeah, that's very different, right? So, I mean, I think that there are tons of medications that affect probably your brain functioning, including causing confusion and so on and so forth, but not necessarily causing, a dementia, as an insult to the, like when we talk about major neurocognitive illnesses, what we talk, like dementia, what we talk about is a disease process, like the doctor here said, is Dr. Naqvi said that, talking about, a disease process like Alzheimer's disease, right? That actually is a disease. There is another illness in dementia called vascular dementia. Now, some of that stuff can be preventable in the sense that if you are looking after your cardiovascular health, which is what the early session today was, then that will potentially decrease the chances of you having like a vascular dementia, which basically means you get small strokes in the brain. And she's the stroke expert, so I'm not going to tell you more about that. She can probably expand on that. But those kind of things, are something that you can do something about. But things like Alzheimer's disease, unfortunately, is a disease that affects many people. There is a very aggressive type of Alzheimer's disease where it happens in young people, like at the age of 50. Now, thankfully, it's not very common. But if that happens, then there is a very high genetic predisposition, like genetically it runs in families. But Alzheimer's disease usually happens at a later stage in life. I don't know if you want to expand on that, but...
No, I was just going to say, I think that was an excellent question. I didn't catch your name, sir. Sir, your name?
Ibrahim.
Sir Ibrahim, Brother Ibrahim. I think that really brings to light the real question of what is dementia versus what is just, I'm having confusion, I'm having memory problems. What's really going on with me? Is it the medications I'm taking? Is it because I'm low on vitamin B12 or my thyroid is off? Is it because I'm not sleeping well? So do I have sleep apnea? Is it because I have been mentally under a lot of duress and I have been dealing with a lot of changes in my life, and so I'm feeling like I'm slow? So yes, it could be any of those things. Before we get to the point of this is neurodegenerative, there's no way of going back, we're going to continue to worsen, we need to sort of think about what else it could be that is remediable that we could potentially reverse. So yes, there's lots of causes for reversible causes, and then there's also rapidly progressive dementia, which is rare, but it can happen in the young, it can happen in the middle-aged, in the elderly, and those have very different causes that can be assessed, and typically it has not great prognosis, but if there is a cause that's found, could it be that it's genetic, and therefore do we need to test further in different family members? So if we find that somebody is rapidly worsening, and by rapid it means within a month, and by 6 months things are too bad, then that definitely needs to be medically managed.
And just briefly, I think where this maps in the caregiver journey is really critical, because this is that kind of early beginning stage of just beginning to recognize something is maybe wrong, but that the kind of maybe your parent is probably not ready to recognize that themselves. That's something that we experienced. My mother, who was the one that was ultimately diagnosed with dementia, she was a pediatrician. She had, prodigious memory. She was, the heart of our family. And, part of it was also masked by my father's complicated diagnosis. So the path to diagnosis in and of itself is a journey. Getting there is complicated and taxing. And once you arrive there, it's no more easier. Right? Now you have to decide, are you going to maybe do an aging in place? Are you going to, go to a home? What are the conditions that, that you're willing to accept and change? But I will share one anecdote. Hopefully you don't have to go through this, is the kind of precipitating factor that led to the kind of clinical diagnosis for my mother. And I say this even having my older sister is a geriatrician, so we had all the kind of medical, know-how in the family, immediate family. It was during Ramzan. She was fasting. She was driving home from a majlis in the rain. I got a call from the police. I picked her up in Queens. She drove way past our home, and she drove down a one-way street. Thankfully, no one was injured, no one was hurt, and she was just confused. So that was, I think, even for her, a kind of point of recognition. Just, it could have been worse, right?
Can I just make a comment? I think one thing that, as a community, we don't pay a lot of attention to. Dr. Naqvi talked about, the reversible forms, right? So, these are not reversible forms of dementia as such, but they are reversible forms of cognitive impairment, right? So, with people who have cognitive impairment, talk about thyroid, all of those things. One of the things that we miss a lot in the community is in old people when they get depressed, right? So when you have a major depression in an old person presents very differently to how a major depression presents in a younger person. So one of the symptoms of depression in old people may just be difficulty in their function, difficulty in their thinking, difficulty in their cognition, difficulty in all of those things. And sometimes we don't pay a lot of attention to the fact that they may actually have an underlying depression that is manifesting itself in like a cognitive impairment. Now the good news is that if it is depression, then it's reversible, because depression is actually quite treatable. 80% of depressions are treatable, right? So there are things that can affect memory, that can affect function, that can affect cognition, that may present as dementia. So when you look at a geriatrician like myself, we don't just make a diagnosis. We will do blood work and CT scans and all of those things to rule out these reversible causes. But one of the things that I think we miss a lot in our community is an underlying mental health illness like depression. And it's unfortunate because a lot of our elderly patients actually suffer from it, but the outcomes are really good if you're able to recognize it.
Thank you. Uncle Inayat, you had something to add? Do you mind speaking up? We have a wired mic, so I can't quite get it to you. I can try. Sorry.
Assalamu alaikum. Talking about the dementia. When the patient comes to you, you will diagnose the dementia from the symptoms they exhibit to you. However, how can the family, what they should be looking for, or to see that, okay, I think this onset of this kind of disease, that they should take the patient or the family member to the doctor to see them. Because dementia is really on the rise in this country, North America, everywhere. All of a sudden, it's a stage 3 dementia, whatever the stage you call it. So what should we be looking for in the family? On the dementia, and then I'm coming on to Parkinson's disease, which is also on the rise now. That's it.
Thank you. Mama, would you like to take this one? Sure.
Well, I think that's a really good question. And I feel like we've talked about it at another panel in the past, and I think that's a really important question. Again, we touched upon the signs of dementia, or when we're starting to think somebody is having symptoms, perhaps they are not cognitively as functional as they were. But then it's about your perspective. Is it me that is taking myself to the doctor, or is it my family member who's taking me to the doctor? How do you take someone to the doctor? Do you put them in a wheelchair, tell them, I'm dragging you to the doctors today? It doesn't work like that. It has to be a mutual decision to acknowledge that there is a difference and that we need to address that difference. So I think it's that approach that's so difficult. And it's something that I am dealing with my parents who are elderly. I was the youngest by many years, and us as siblings are trying to figure out what's the best way to take care of our parents, and it's a very difficult journey. And so I'm actually here to learn from all of you. How do you tell your parents when they have told you your entire life who you are, and it doesn't matter what your professional capability is or your personal potential is? It's about that relationship with your parent, how your relationship is able to circumvent all of these differences in how once we were a child and now we're the parent, but we're not. We are on an equal footing, and so any decision we make has to be together. And I feel like that's part of the only way forward as a caregiver or as somebody who perhaps needs care now.
Yeah, I have a two-part question. I'm a caregiver. You sure? A two-part question is for one for Brother Ali. Do you mind sharing how old was your mother when this happened? Because sometimes they're sitting in denial and just thinking it's not going to happen.
Yeah.
And the second question is, what's the difference between dementia and Alzheimer's? Is Alzheimer's progression of dementia? Please redefine that. Thank you.
I'll just quickly take the second part. So dementia is a... Yes, so the question was twofold. I'll take the second part, which was what is the difference between dementia and Alzheimer's dementia? So Alzheimer's dementia is a subset of dementia. It is the most commonly diagnosed type of dementia, but that is in part because we are now starting to understand the different other dementias. So I would say dementia is the basket, and Alzheimer's is one of the things in the basket. One way to differentiate Alzheimer's dementia from other types of dementia, yes, Alzheimer's is neurodegenerative. It worsens over time. One of the first key things for Alzheimer's dementia is, again, the visual-spatial orientation, getting lost in places, having trouble with word finding, not being able to retrieve what you were thinking of, to the point where you try as hard as you can and it doesn't come back to you, is just gone, meaning that memory was never made or retrieved well enough. That would be one of the early things to think about in terms of
And it's hard to say, but I mean, the diagnosis came in, when she was 68.
As dementia progresses into Alzheimer's.
So let's make it easy for everybody because this is being asked a lot. So dementia is a general term. Okay? Dementia is just a general term. Right? And then there are many types of dementia. And Alzheimer's disease is one type of dementia. It's the most common one. So it's one type of dementia is Alzheimer's. I like the analogy that Dr. Nakri gave about a basket. So the basket is dementia, and there are many different things in the basket. The most common thing is Alzheimer's.
My question is, if a child comes up to the parent and says, oh, I'm not getting very please go see a doctor and go for an MRI. How safe are you taking this? How far should we go to get ourselves diagnosed?
Okay. MRIs are safe. They're non-invasive. They're very safe. But let's be clear about one thing. Dementia is a clinical diagnosis. There's no blood test. There's no radiological test like MRI or CT scan that can diagnose dementia. It gives you information. So, if you have an MRI and you see that the brain has, shrunk and all of those things, it gives you the clues that yes, there is a potential dementia. But dementia is a clinical diagnosis, which means it is based on the symptoms and signs of what the person is suffering from. I wish we had a blood test for dementia, but we don't. There is no blood test for dementia. Yeah, it's a very good question. In fact, there's some really neat studies about brain exercise. The question is, does brain exercise help with dementia? There's a lot of things that help with dementia, actually. There is good evidence about brain exercises that actually help with dementia. I don't know what the app is like, but I gotta tell you, if you have the right, there are many apps out there now that help the patient stimulate their brain. But I want to tell you one other thing that really helps with dementia, and that's exercise. If there is one thing that you can do for your loved ones, is to get them to move. Now, sometimes with the caregivers, right, they love their loved ones so much, right, that they don't allow them to do anything, right? So, oh, no, I'll do it for you. Oh, no, don't go here. I'll do it for you. I'll take you here. I don't care how you walk. You can use a walker, you can use a cane, you can use whatever you want, but you gotta walk. You gotta move. Because there is good evidence that brain exercises and like mobility actually has an important aspect. Now, I have to say one thing, sorry, and that is that your spirituality has an effect on your cognitive thinking. I have to say this, right? Because that's an area of expertise of mine. Well, I shouldn't say expertise of mine, an interest of mine. But actually, the studies around spirituality have mostly been done by the Jewish community, not the Muslim community. Isn't it amazing? We have such an amazing, legacy with our imams. And if you look at the hadiths of the imams and how they talk about cognitive impairment and the importance of your spiritual well-being, that how it helps. We unfortunately have not done a lot of research in this area. It's our Jewish friends who have actually done a lot of, but there are things that can definitely help. Right, so I'm supposed to now take over the facilitation of this, I'm told. Oh, are you here? Oh, okay, that's great, okay.
I want to ask you one question about this loneliness. Isn't this whole disease starts with loneliness?
Loneliness, hopelessness, and boredom. These are the three main things. Loneliness, hopelessness, and boredom. Right? So, Sheila Bai talked really eloquently about routine, right? If you can have a routine, it really helps, right? But what also helps is being a bit spontaneous, because it brings life to the person, right? So if you go to a long-term care facility, you will see that they play bingo a lot. Why do they play bingo? They play bingo because it's unpredictable, right? There is some spontaneity in that, right? So these are the kind of things that, you were talking about. So, yes, loneliness is a terrible disease, actually, in old people. Loneliness, hopelessness, and boredom. And that's where I come back to the family support system, the community support system, right? Where there is, sometimes, you think, oh, well, she just sits there. She doesn't do anything, right? Kali betha cho, kain karta nati, betha che. And then, what I love to see is chaos in the family. When you are in your living rooms and there's kids running around and plates are being broken and something is being spilled on the carpet and and you know, there is noise and people are, you know, notifying each other, you know, you're not doing this right. And this is great. When I go into families and see this, for an old person who you think is just sitting there, this adds a lot of color to their life. Right? Am I right? Yes, Shilava? You use the mic, man. Why you're not using it?
Yes, I definitely agree with that because when mom moved into Femi's place, there was a lot of chaos in that house.
There still is.
And but she loved it. She loved it. She definitely loved it. And everybody saw her vibrant and much better than when she was living alone in Dutch Gate. Definitely, I agree with that. Yeah, it brought her.
But it's live now, right? No, keep it on.
Forced to do it.
I think it will help them not in the future, but in their present as well.
Assalamualaikum. I actually know the answer, but I think it's really important that everyone can answer. This is a question for all four of you. I'm going to divert to caregiver in general. For the caregivers and for the physicians, what would have made your life easier to take care of these aging patients, whether it was for dementia, whether it's terminal illness, cancer, diabetes? What documents, what things, and things that you put in place would have made it easier for both you, the patient, and the physician to take care of them, whether it be medications or advanced directives or different policies. So I think that's a really important thing for all of us.
All I can say to you is wait for the second session. When we are talking about so I think that, and we have Samir Bhai is here as well. I think what is the most important is to educate. I think we lack in education. And I think educating the community and the families about what resources are available for you locally in your, what do you call them here? City, boroughs? Is it boroughs? Yeah. So what is available for you with respect to home support, with respect to community support? What does the government provide you with?
Assalamu alaikum.
We do not maximize.
Welcome to our career fair. We will be starting the panel and introduction, etc., in the next 5 minutes. So you could take about 5 minutes to finish browsing the booths for now. The booths, as I mentioned before, are open throughout the program. So don't worry. If you didn't get a chance to go around everywhere, you'll get a chance afterwards. But you have about 5 minutes to finish browsing the booths and then make your way to the front.
Discussions early in the journey, because as a community, I gotta tell you, we don't like to talk about this stuff, right? We find it very difficult to talk about it, and then we leave it too late. So for me, if I had all if my patients and their family, one of the things that I do the most is to actually educate them about the illness, educate them about what to expect, right? Tell them this is what this is what's going to happen, right? This is how it's going to go. This is what it's going to happen. This is what the journey is going to look like. And at every stage of that journey, you have to prepare. And if you plan ahead and prepare yourself, I think it makes life a lot more easier.
Have you seen the car run into like a big air cylinder in the back? No? This is a big air cylinder. This is a
I don't know if there's any other wireless
So now if I use that,
wait, could you like tap it and I'll tell you?
So nice to see you. This is amazing. Oh my God. Oh, HR is over on that side. I don't know what happened to their sign, but that girl with the black hijab and the gentleman there with the glasses, they're HR.
Do you see what she's talking about? Yeah, I do. This is Nuria, by the way. Hi, nice to meet you. Sorry for being a little bit.
I want to just say one thing. Mohammed Bhai, thank you for your comments. I really appreciate that.
Can you use it?
May Allah bless you for all that you do. There is one thing that's really important to understand and not get into the trap. Now, I'm going to be a bit controversial again, and I want you to take this in the spirit that it is meant. And sometimes I have a real problem when we have people who do what I call religious blackmail. Okay? So Islam emphasizes so much on how you need to look after your parents, right? Its emphasis on parents is equivalent to, the worship of Allah subhanahu wa ta'ala, right? Islam really emphasizes the importance of obedience to parents. It says uffin in the Quran, that you should not even raise your voice by saying uff to your parents. Sometimes what I hear, and it really bothers me, and I hear this sometimes even from scholars, and they say to you, no matter what, you got to look after your parents until the end. And I think that's wrong. I think that you need to make sure that you do the best for your parents. And the best for your parent may be that at a certain stage they need to go into a home. Because you cannot provide 24/7 care. Right? And that was the difficult issue that I faced as a caregiver, right? And even my own siblings, right, were, even up to today, my own siblings would say to me, how can you put her in a nursing home? Like, shame on you that you put her in a nursing home. She should have been at home and you should have been looking after her 24/7. It's not possible, right? It's not possible in this part of the world. When you are working, your wife is working, your kids are in university, right? And you have an elderly person who's falling all the time, right? In the house. How do you do this? How do you manage this? So be really careful when somebody uses religion to make you feel, and I come back to the guilt, make you feel guilty. You're not a good daughter, or you're not a good daughter-in-law. Like, shame on you, right? You're not a good son, right? Imagine, you have a geriatrician sister, you have this. You can't look after your loved one. It's hard, right? It's not easy. It's really tough. And so let's not get into that judgment, blame game. And sometimes our community does that, right?
Let's try that again. Okay. If we can all make our way to the front of the room here and take a seat, we're going to get started with the program.
It's something that we really need to be very careful with as a community when this kind of things happen.
I have a question. Can I have a question? I have a question. So, in my head, the ideal case scenario would be to have for somebody with dementia would be to have hustle bustle in the house. So, that ronak, so that they have little ones that they can play with, they have older ones that they can have conversations with, and people who are available to help, right? That's what we are all kind of looking for. To me, however, the problem is this sort of idea of nuclear family has taken away from the village that we used to have. So what can we do to kind of recreate that in our community? Because yes, most of us have jobs. The ones who have the little ones that the older ones can benefit from have to work. The older ones who are probably closer to retirement maybe don't have to work as much. So what are we doing in the capacity that we have to recreate that type of village where we have support for the little ones and the older ones across the spectrum? I think maybe.
Okay, so we have about 30 seconds to get seated, and then we're going to start with some verses of the Quran.
Perhaps our elders used to have. That
We'll have an opportunity to browse the booths afterwards, so if you can just make your way to the front of the room, we'll get started with the speaking portion of the program.
elderly being used to that village that they grew up in, and then they are transplanted into our community where nobody has time for anything, including themselves. So how do we make that better? Because society is not exactly beneficial. So how do we create our own micro-ecosystem?
I think that's a beautiful, ideal, maybe vision. How we achieve it, I don't know. I can just share that, we had what you just described, the kind of like full household of Ronak, 3 generations under one roof. We had our third born, actually the same year that my father passed. So my mother was around for, to see her 3 grandkids, but in a capacity that she was really diminished. She was not talking, she was not walking, she was...
Okay, thank you so much for attending our career fair today. This is our 3rd annual career fair. We are going to get started with some verses from the Quran. I'm going to invite Brother Aryan Kalfan and Sister Sabah Fatima Jivraj to enlighten us.
In the front with the cameras. And they've had that benefit. However difficult it was for them to see, there's in hospital beds, in the room, but every day, they would go there. Actually, my little one, she would go there every day, spend a lot of her time there, because it was just a fun room for her to kind of play. So I don't know if a village can solve it in America, but I think we can recreate whatever we can in our own way, in whatever form it takes.
Thank you.
It's going to be different for every family.
My dear brothers and sisters, can I have your attention, please? We're about to recite the Holy Quran. Please let us respect it, please, with 5 minutes of silence, please. Ladies and gentlemen, please focus. We're about to recite the Holy Quran. Please, we need respect and silence, please. To all the children talking and not paying attention, you're disrespecting the Quran.
So I think that...
Please, let us give it the respect that it's due.
Really
and let us please, just for 2 minutes, pause the talking. We're going to be here for the whole day. But Muhammad wa ali Muhammad salawat.
It's an opportunity to develop a body of experts.
Assalamu alaikum. My name is Brother Aryan Kalfan, and I'll be reciting Surah Najm, verses 39 to 41.
There's not a lot of community like New York.
أعوذ بالله من الشيطان الرجيم.
look at this today.
بسم الله الرحمن الرحيم. وأن ليس للإنسان إلا ما سعى وأن سعيه سوف يرى ثم يجزاه الجزاء الأفوى صدق الله العلي العظيم.
The older population and provide that support.
Bismillahirrahmanirrahim. And that there is not for man except that good for which he strives, and that his striving is going to be seen. Then he will be recompensed for it with the fullest recompense.
creating
These verses highlight a key teaching in both Islam and our daily lives. Success is the result of one's efforts, and every individual will receive their due reward based on their hard work. Whether it's working towards a career, pursuing education, or striving to improve spiritually, hard work is the key to achievement.
We're not just a
You have
religious
all
center.
taken the first step of coming here
just come
today to learn about different careers, and your effort to come here will be rewarded by Allah. Allah ensures that sincere efforts are compensated in the best possible way, either in this world or in the hereafter. So thank you all for coming out and taking your time out of your day to be here. And we really hope that you all can learn something valuable from this program.
We
Thank
do
you. Salawat.
everything in alignment with the teachings of the Quran, the Holy Prophet, and the Ahlul
Okay,
Bayt,
let's see if this
alayhimus salam, right? I
mic
mean, that's
works.
what we
Can
do.
everyone hear me okay with this
But we're
mic?
still, we're a
We've been told not to
community,
use this
and
one because
that
it's leading into
community
the other
means
hall.
you have
Okay,
to be able to look
so
at the
before we
needs
begin
of
our
this
program
community,
today, it would
right?
be remiss of
And
us
be
not
able
to
to address
recognize
the needs
those
of this
who are
community in
around
a
the world
way
who are in a
that
tougher
will make
situation
their
than us.
lives
We have so much
vibrant.
privilege
And I
being
think
here.
that that's
We are blessed with so many opportunities. Our brothers and sisters in Palestine, Lebanon, and around the world do not have these same opportunities at the moment. Let's observe a moment of silence and reflect on that and pray for them, please.
Item on the agenda, so I'm trying to begin.
Yes.
Sallallahu Muhammad wa ali Muhammad.
Okay, thank you. So we really, really appreciate all of you that have taken time out of your schedule to join us for our third annual career fair, mashallah. The vision of this event is to bring together all of the wonderful talent that we have in our community and provide a chance for all of our children and youth to learn from those who are more experienced in their fields. We hope that this opportunity sparks something in you. So hopefully you'll get an idea for a future career, or you'll meet someone that you can learn something from, or maybe you'll learn about a field that you never even knew about. Before we jump into thank yous and introductions of our booth participants, I want to say a thank you to all those who registered in advance for this program. So what we've done is we put your name in a bag, and we're going to do, usually we do our raffle prizes at the end. You all know that, those of you who have come before. And you've seen the basket of prizes over there. But for those who registered in advance, we're going to do an early raffle. If I can find Sister Ruth,
I have a last thought.
An envelope with a cash prize.
You know, I have a 4-year-old.
And even if I
She
can't
would
find
love
her,
to
I
hang out
promise
with the
you're going to
elderly.
get it. So we're going to
We could think about creating a little program
Who's
where she
feeling
could
lucky
go
today?
see more
Who's
older
feeling lucky?
people.
Kyan,
She
you're
would be
feeling
very
lucky?
happy
Okay,
to.
I'm going to ask you. Close your eyes and pick a name out of this. you can open your eyes to put your hand in the bag. Now you can close them. Yeah, go ahead. Pick any slip. Oh, not the big one. We lost some. Hold on. Technical difficulties. Yeah, pick one of these out. One of these people is going to win a cash prize courtesy of you. Okay, and who's winning the cash prize? Fatima Merchant. Is Fatima Merchant here? Oh, okay. Allah's for Fatima Merchant. Allahumma salli ala.
We're going to set up now
And Sister Ruhina
for a really
has noted who
important
Fatima
discussion
Merchant is, and she's going to get you your cash. So thank you for
on end
registering
of
in
life.
advance, and inshallah next year we will have all of you registering in advance. But don't worry, there's many more raffle prizes to come, and we will be doing the drawings for the other ones throughout the program and at the end as well. So, a few thank yous and a few introductions. To our volunteers, we're so proud to have you as part of our community. Thank you for showing up year after year to share your experience with everyone. Participants, thank you again for coming and showing that you're willing to learn. And of course to the executive committee, Brother Hussein Aziz and his team, Sister Rehana Jaffer and her team, they of course have made it possible for us to use the center today. Now we're going to go ahead and introduce all of the individuals that have come to the booth. So if you are a volunteer at a booth, you can go to your booth just now because I'm going to do a quick round robin around the room and introduce everyone. I know it takes a little bit of time, but I've noticed in the past that when we don't know who we have in the room, we don't always realize to go to the different booths. So I'll try and be really quick. I'm not going to read everyone's full resume, but I'm going to make sure that you you know who's in the room. So if you're a volunteer, you can go behind your sign just now, and I'm going to quickly run around the room. Okay, so I'll do my best to be fast. Starting way over there in the corner, we have the architecture and engineering booth. And when I say your name, you can give a quick
Hey, assalamu alaikum everyone. Thank you guys so much for attending, registering. We're going to give out some raffle prizes right now. So we have a paddle ball set, and we're going to call out the names.
Okay, right next
Nami
to them,
Abdullah.
we have the IT booth.
Nami, where are you?
Hey there, senior
You got a pickleball,
cybersecurity
a paddle ball
consultant.
set.
Ayaz Versi,
Now we're gonna-
embedded
no.
systems developer at Atlas Power. Brother Asim Mulani, business value consultant.
Now we're going to do pickleball. Next raffle is for pickleball. Shahid Lakhani, you got pickleball.
Moving on, next to them we have marketing and
she
sales.
registered.
That booth looks like
Third
it's
one is for Aveeno
popping.
lotion for this really cold weather. Abbas Walji. Abbas Walji.
And we have Ali Abadi from Queen's College studying computer science.
Perfect.
Did everyone spot them? Okay, moving on. We have human resources. Where's human resources? It got flipped. Okay, I'm going to introduce human resources because I cannot spot where they got flipped to, and you can all just wave wherever you are. Nuria Zaidi, Senior Talent Acquisition Partner. Samir Murali, Talent Acquisition at HomeServe USA. And Minaz Leda, Manager, Talent and Organization Development Operations at NBC Universal. Fantastic. Moving on. So who did I miss? You just got in the wrong order. Is that what it was? Okay, sorry about that. Education. Okay, education table, make some noise. Okay, we have Sister Ruqayya Rahim, MSAD, Special Ed Teacher and Applied Behavior Analysis Therapist at Brookville Center for Children's Services. Sister Rabia Hassanali, I think couldn't join us today, but she's a Director of ENL and World Languages at the ISIP School District. Sister Rabia Dinani, MSED and General Ed Teacher in New York City Public Schools. Sister Fatima Jaffer, School Psychologist at Island Tree School District High School. Sister Alia Mukaddam, Hofstra University, Early Childhood and Childhood Education, pursuing her Master's in Special Ed. Sister Zohrain Megji, where are you? Sister Zohrain Megji, MA in Childhood Ed, Middle School Extension and ELA Teacher in New York City Public Schools. And Brother Mujahid Dungarsi, I know you're sitting in another booth, but you're also a teacher. I cannot spot you right now, but he's in the audience. He tricked me. Okay. Moving on, we have a resume review booth, and we have Brother Akbar Rizvi and his son Raza. They are there to help you with your resume, your LinkedIn profile. Even if you don't have a resume or LinkedIn profile, go visit that booth and tell him the items that you've done at school, your volunteer activities, your extracurriculars, and they will help you to craft something. Okay, moving on to entrepreneurship. Brother Duad Khalfan, co-founder and CEO of Secure Tech Systems. He has his MBA in business management with a minor in entrepreneurship from Stony Brook University. We have Brother Mujahid Dungarsi, who again is in the audience, but he's at that booth too. He does e-commerce, and he's also in mathematics and special ed. Brother Babu Khalfan and Sister Tazim Khalfan, business people and founder of Build a Life Foundation. Sister Amna Hassan, founder of Abul Fazl Puzzles, and Sister Zainab Rizvi, lawyer and owner of Alula Daycare. Okay, let's move on to the big long table at the very back. The big table in the back, and I'm not going to feel offended if you want to turn around just so you can spot them. Okay, so that table is for colleges, scholarships, financial aid. We have Brother Mazahir Tejani, Assistant Director Compliance and International Students and Scholars Office at Columbia. We have Malika Shivji, Hofstra University, Health Science, Pre-PA. We have Sabra Muhammad, Hofstra University, Health Science, Pre-Med. Fatima Zara Murji, Adelphi University, Computer Science, Biology. Amina Murji, Adelphi University, Computer Science. Saif Khalfan, Fordham University, FCRH Honors Integrated Neuroscience Pre-Health. Zainab Khalfan, Bernard College, Human Rights.
Okay, Bar Muhammad wa Ali Muhammad Salawat.
Lehigh University, Psychology, Developmental Clinical Concentration.
New York, come on, Bar Muhammad wa Ali Muhammad Salawat.
He's still on the other side. He's still on the other side and he's coming over. He's at Malloy University in nursing. Brother Riza Aziz, I think he's on the other side right now too, but he's first year med student, so CUNY School of Medicine, and he's interested in orthopedic surgery. Ali Abbas Khalfan.
We are going to raffle a couple of prizes and then we're going to start some serious conversations. So if I can have people in the back, especially if you can take a seat, if you want to be part of this panel, if you want to have a chat, please go to another room.
Roshan Ali Delji, Delphi University, Speech Language Pathology, and Mohsen Ali Muhammad Ali, Truro College of Medicine,
Right?
Medical
But
Student.
Muhammad wa Ali Muhammad salawat.
Oh, I think we have to make some noise for that table there. They're sitting very patiently through all the introductions. Yeah, thank you. Okay. Now we're going to move on. Let's move back away. I think I'm out of order.
I think it's from there.
Because I see some signs are switched. We'll start with non-profit.
Okay, we're going to raffle a couple of raffles. Are we raffling?
Tosin Morali, PharmD, Medical Drug Information.
Hey, Assalamu alaikum everyone. If everyone wants to pay attention in the front, we have a cookbook from Zara Alibai. She is our fellow Koja from Toronto. She's going to be in town this weekend signing her books tonight at Kawa House. It's a wonderful book. There's a lot of American recipes, Asian recipes, and we're going to have Dr. Mitani pull that out. These set of names are the people that registered early. So we love it when people register early because then we can accommodate numbers. So, Dr. Mitani, please. This is for the cookbook.
Vice President and Council, Blue Owl Capital. I think we got all of those people. Okay, and now we're at the Religious Studies booth.
Nisar Kareem. Is that
from the Department of Middle Eastern Languages and Cultures.
Perfect. You can give it. Your wife is a cook, so.
He is a religious scholar. Some of you had an opportunity to meet him while he was reciting earlier this week. Okay.
And then we have one more. It is a blood pressure cuff.
We have Sister Mumtaz Jaffer, Strategic Partnership Development Manager at Smart Home Google. We have Sadiq Keshwani, AVP at Morgan Stanley. He has a BSc in Finance from King's College. And Shuaib Balu, I think, is not here yet, but joining us later, CPA.
Sukaina Mustafa Jaffer, I think she's on the other side for careers, no problem.
Muhammad Rakhani,
oh, she's here.
Radio frequency engineer and day trader, and Syed Hussein Jaffrey, PCB technician.
Okay, now we have a set of weights. Should we do it from the
emergency response? Brother Muhammad Zaidi.
Ali Jawad really wants these early registrations to come in. A set of 3-pound weights.
His equipment. Yes. Oh yeah, you did. Okay, great. We have Professor Jaffer.
All right, let's go back. Okay, now Ali, you want to pull it from there? Okay, Ali Jawad is going to donate it back.
Makeup artist. Did we get all of our wonderful volunteers?
No, we still have this.
I think so. I think they deserve. Oh no, I'm so sorry. I'm just looking right at them. I forgot about healthcare because usually they're taking up the whole back of the room. Guys, you're gonna have to stick with me. You think we can get through this?
Ali Jawad.
Okay, let's try. You guys have been waiting.
You cannot take it in your suitcase. Let's put it back.
Sciences. Fatima Muqaddam, NASM CPT, computational chemistry PhD student at NYU.
No, he's picking it.
Matani, senior at Barnard
Sherman
College.
Pajwani.
Neuroscience and
She's on the other side.
Double
she's
minor
here.
in science and public policy and Korean. Research intern at Weill Cornell Medicine and
we're good. Okay, we have one more yoga mat.
Coordinator at the International Neuroethics Society. We have Sister Saira Madad, Senior Director Systems Special Pathogens Program at NYC Health Plus Hospital.
Yoga mat. Perfect. Okay.
I did see him somewhere. PhD in medicinal chemistry, Senior Director at
We're going to start this session. I really want to ask the people in the back and on the side.
Engineering and research scientist at Stony Brook. And we have Nasreen Dungarsi, who is a farm
I'm going to really ask you either we can take your seats or we can have a conversation in another room. It's all good. Conversations, networking is really good. Right, so either we do that or we take a seat, yeah? Including the people in the back.
Baker, who is a critical care physician
Guys, in the back.
at NYIT. Sister Aliza Raza, DO, family medicine and urgent care physician.
All
there
good?
You are. We have Sister Zamina Aziz, I think
Fatima,
she's
you're
from
good?
the other side. She is an internal
Fatima, you're
medicine
good?
resident and medical ethics fellow at Lenox Hill. We have
All right.
Brother Muhammad Abbas Khalfan, I think he's also coming over from the other side. He's a nephrologist.
So this is a really important session, you know, and I think it'll bring together some of the things that we were talking about, you know, earlier today.
I think he's probably still
This is a panel that when I came here last time, the members of the community really asked me if we could do this panel and Ali Jawad wanted to organize it. And so we're going to talk about the end of life decision-making process.
Okay, I think we got everyone.
Right?
So a
Now
lot
you may say, well, I'm young, I'm not end of life, and I have to tell you that that's not the case. Right? It applies to everybody. And it applies to everybody because either you will go through this journey or you will be part of a family member who goes through this journey. So I'm really excited right now to introduce the panel. And there's three of us. I'll facilitate and we will see if we can have, our panel members give their perspective. And also, most importantly, we want to hear from you. Right? And we're going to do this in a case-based way. So we're going to present to you an actual case that I have been exposed to, and a case that actually will hopefully bring out some of the important issues around this whole area of life. Right? So I want to introduce Samir Ladha. He's actually Samir Dinani, but for some reason somebody missed out the Dinani part. It was too long to say Samir Hussain. Hey, Samir Haider Ali Ladha Dinani, so somebody missed out. There's not enough space. So it is Samir Dinani. We're really happy to have him here. Samir Bhai is an attorney by profession, the former deputy director for bioethics at Columbia University, right? It comes really, it's really fantastic to have somebody like him who can provide us with that perspective. On my far right, we have Dr. Zamina Aziz. Right? Now, she's of course very dear to me because she's my daughter, right? And Dr. Zamina Aziz, mashallah, is now, living in New York. It's one of the reasons probably that I end up visiting New York a lot more often than probably you would have seen me. Zamina is an internal medicine resident at Lenox Hill. In New York, and she has a master's in bioethics from Harvard University. So really fantastic to have you here. I'm going to present the case, okay? And this is a real case. Right? So we will, we'll look at the case. We'll take initial questions. We'll ask a little bit about what your views are. How do you feel about it? And then we'll make some recommendations at the end. Okay? So let me just tell you the case.
Yeah, exactly.
So the case is of this patient. I'm going to call him Amir Malik. It's not his real name because we want to, obviously, for privacy reasons, we want to protect the real names of our patients. So Amir Malik is 83 years old.
Good?
Is that on? Because maybe if it's on, we can turn it off. Yeah. Yeah, turn that this. Maybe it's where I'm standing. Okay. Anyway, Amir Malik is 83 years old.
Okay, so apologies for the technical difficulties. We're going to try and get started with...
Right, it's on the slide. It's a big hospital in Vancouver, and he's currently admitted into the ICU, the intensive care unit, with aspiration pneumonia. Now, aspiration pneumonia means that when you eat, the food doesn't go into your stomach, but because you have problems with swallowing, it goes into your lungs instead. And because it goes into your lungs, you develop a pneumonia, right? It's called an aspiration pneumonia. Now, his vital signs means that is one of the things that you have to, his blood pressure is not bad, it's quite good. His temperature is a little bit elevated because he has a pneumonia, right? And O2 saturation is at 80%. Okay, O2 saturation basically talks about how much oxygenation he has in his body. It should be over 95%, but his is low at 80%, so he's not getting enough oxygen into his lungs, right? So he has a history of dementia. He has a history of vascular dementia, okay? He also has coronary artery disease, and he's had a heart attack in 2017, right? He also has problems with his kidneys. He has chronic kidney disease. So his kidneys are not functioning as well, right? Who's a previous smoker. He smoked 2 packs, basically since 1950 to 1990, right? He's got an irregular heartbeat. It's called atrial fibrillation. So his heartbeat is irregular, which puts him more at risk for strokes, right? And he's had 2 falls. It's a pretty complicated guy, right?
I'm passing the mic over
he's
to
pretty,
Serena.
he's pretty ill,
Right?
right? He's pretty sick. Now, Amir Malik is currently in the hospital due to a recent and recurrent aspiration pneumonia. What does that mean? It means he has this pneumonia now, and he's had it many times before, right? So it's recurrent. It's his 4th admission this year. So this year, this is the 4th time he's been admitted, and each time he's been admitted, he stays in the hospital for about 2 weeks. And then, he gets admitted into the ICU, he semi-recovers, and then he goes back home, and his quality of life is worse than when he came in. Right? So every time he goes home, he declines further. He becomes more dependent on his, family, right? And he's now he's not mobile anymore, and he's bedbound.
I know
He's in
we've
bed.
spent quite a bit of time on introductions, so
He
I'm
can't
not
walk.
going to introduce today's panelists. I'm going to ask
The
them all
nursing
to
staff in the
introduce
ICU know him quite well because he's been there like 4 times in the year,
and your current
right?
position.
And they say that when he
You're
comes to
having
the
a hard time
ICU,
hearing,
he's
I
like
would suggest
super
you just move
confused.
up because we're doing the best we can.
He gets very
But if you can't hear us,
confused, he gets
just move
very
up.
agitated,
We don't fight. So even
and
all
he
of you over there,
actually
you can feel free
hits
to move up.
out
There's no problem.
at people, and so they have to restrain him. They have to tie him up to the bed. His daughter-in-law, we call her Sarah, right? Sarah, brought him in this morning, and he has significantly deteriorated, and he's now in ICU, right? Now, the social history is that Mr. Malik lives with his daughter-in-law Sarah and his son Bakr, as well as his 2 grandchildren who are both 8 and 5 years old. Sarah is his primary caregiver. She looks after him at home, right? And she had to quit her job. She was a teacher. She had to quit her job in 2018 when he was diagnosed with dementia, so that he could take care of, so that she could take care of him in the house. Bakr works at a marketing firm, and he has very long hours. Mr. Malik's wife died about a year ago because of ovarian cancer, and since her death, Sarah has noted a very significant change in Mr. Malik's mood. He sleeps more during the day and constantly says, "Ke mane mari bairi sathe chaunche." I want to be with my wife. I don't want to live anymore. Right? This is what he says all the time.
Thank you so much for those introductions. I'm going to start off with
The clinical team
when you started off
has now expressed this time, this is the 4th admission this year, they've expressed this time that they don't think that we should put a tube down Mr. Malik's throat and put him on life support, on a mechanical ventilator. Why? Because the team feels that he's now coming to the end of his life. And we should just keep him comfortable, and let him pass. Right? They feel that his goals of care should be now of comfort care. Provide him with comfort because this is his fourth admission in the hospital for recurrent pneumonia. And in the context of somebody who has a vascular dementia and problems with swallowing, Bakir the son, however, is adamant that his father should be intubated. Bakir is saying you should do whatever you can to keep him alive for as long as you can. Right? He says that, look, this is his fourth admission. He's recovered before, he can recover again. Right?
I was probably 15 years old. And
Mr. Malik
for a job at a restaurant.
lives. Oh, I did this right.
So I said, all right. And so this was in Port Jeff.
This is the one, right?
By the harbor.
So now I'm going to ask some initial questions, right? And the initial questions is, how does Amir Malik's case make us feel? How do you feel about this case?
I submitted my application. I asked.
Fatima, yes? You said what, sorry?
Looked at my application.
Sad and depressed.
You have no prior-
It makes you feel sad and depressed.
I said yes, but
Okay.
I've sold.
Does it ring a bell
I've worked for a travel agency.
from people in this community?
Can help. And as
Yeah?
he was walking me out, he said, look,
People
all
who
these
may
restaurants
go through this
hire
type of a thing?
Apply to anyone,
Right?
and you'll get a job.
Um,
I was driving home. Yes,
what do you think, Zamina?
I was driving home and I said,
How does
you
it
know
make
what?
you feel?
I really want that job. And I turned the car around.
Hello,
and I went back to the
Bismillahirrahmanirrahim.
restaurant.
Can everyone hear me okay?
I didn't have a plan.
So I think I agree with the sentiment, and I think that the sentiment of anytime we see something really difficult in our communities, it's always important to think about how it makes us feel. Because the whole point of, I think, having these sessions is that we don't end up in these really difficult, complicated scenarios where there's a lot of emotion, a lot of guilt, like you said earlier, a lot of thoughts about what does God want of me, what do my parents want of me, what do my family want of me, what do my kids want of me, because that's a lot for one person to bear at any moment in time. And so I think we bring about a scenario like this that everyone in the audience, I can see especially my mom and sisters and everyone in this side of the room, nodding their heads viscerally, saying that they've seen this before, that they've seen what it's like to have somebody in the hospital, they've seen what it's like to ask themselves, is this the right thing to do?
Thank
And
you
I think
so
like
much.
we are in a
So
hospital
now let
environment,
me ask
especially in
you,
America,
Brother
where we have
Ali,
so much
what
technology
inspired
and
you to
things
get
that we
into
can
your
offer
current
to
field? Can you
patients.
share a
put
little bit
them on
about
this,
your
you can start them on
career
this medication,
transition?
You can do this and that. And we want to do what's right by our people, by our family members, by our parents, by everybody, to make sure that they're healthy and that they're well. But I think the question and the reason why this is emotional when people look at this is they ask themselves, is this person also going to suffer? They've been in the hospital 4 times. They're having difficulty swallowing, difficulty breathing. What does it actually mean to have a tube down your throat to help you to breathe when you can't breathe by yourself? Because this certainly wasn't an option for us, 40 years ago, 50 years ago, when, people in the audiences, their parents were going through illnesses. And so the advance of new technologies means that we have to think about what this means for us in our communities and make sure that we know, the difference between a good quality of life and the quantity of life. Because Islam, I think, fundamentally teaches us that in this life, we should constantly be thinking about the next life. That this is just a transition point for us. But we become really comfortable here, and this life is pretty good. And I think we got a lot of cool stuff. We got kids, we got family, we have jobs, we have New York, we have Times Square, we have a lot of fun things in this life. And so I think having that mentality of asking ourselves, what does our transition look like? What does our transition in the hospital and illness, and then potentially transition towards the next life in terms of end-of-life planning, is I think where this case is meant to go. And I wanted to introduce with that. Brother Samir.
Samir bhai, yeah.
Thank you. Assalamu alaikum, everybody.
Alaikum salam.
So yeah, I think the points Zamina has raised are all very valid, of course. I would also say that it's a messy case. It's sad, it's depressing, it's messy, and I think like life, it's messy. And I think in our lives we try to find kind of a perfect solution to every problem. And unfortunately, there isn't a perfect solution. I think we start off with that premise, that there's no perfect kind of solution. This is not going to have a 100% kind of success rate no matter what happens. And so a lot of times in these situations, that's kind of the cards that we're dealt with, and that's where we start. That we don't want a perfect solution because it doesn't exist. But we're looking for the most reasonably sound one, right? So how do we get to that? How do we kind of employ the tools at hand, the people who are involved, the patient himself, to get to that point of a solution that is
I think
viable,
a lot of people
that will give the best
see
kind
business
of outcome,
owners as
whatever that
having,
might be.
a ton of flexibility.
I would say it's interesting
and there's a
that
few of you
this
smiling
case,
at
in
me
many
because you know
cases,
what I'm
talk
talking
about things that a patient is going
but
through.
it's not always the case.
Things that
we
the
wear
family
many hats.
wants.
I find a
things
lot
that
of
physicians and
my
the care
time
team may
on
say.
my
But
daily
oftentimes
basis
what the patient wants
goes to
is not
encouraging my
right at
team,
the
mentoring my
forefront.
team,
And that could be because maybe the patient doesn't have
making
capacity,
sure that
that they can't make the
they
decision
feel
for themselves,
supported and
or other
encouraged,
factors.
and
But the fact that this is
that's
an
actually a
individual
lot
going
of what I
through
do as a
this,
business
I think,
owner.
it's very easy for others to jump in and say, oh, well, this is the best thing for them, and this is the best thing for them. And in this case and in other cases, I think that's really important to bear in mind, that this patient is a person. They're not just a diagnosis, and that they should be consulted in what they think is important.
Growing up, being first generation, it was a little bit tricky.
Now, in this case, we have
my
someone
parents worked
who has
multiple
dementia,
jobs. They were busy. They were at work.
there could be questions of
and so
capacity,
there wasn't
their
a
outbursts that they may be
mentorship
having,
in that
like
same
as
sense, and
mentioned.
especially being first
So
generation, there's
there's
always
a
the
legal
understanding in
question
terms
there
of
as well, that is this
growing
patient
up
able to
here,
make those decisions,
and
if
then
not,
obviously
who
where our
should be
parents
making
come from. So
One other
that
thing I
can
would
be
mention is
challenging
there's
at
a
times.
cultural
So
competence issue
organizations
as well,
like
right?
this
A lot of us,
are very, very important
when
in
we go to
terms
the
of being
hospital,
able
when we go to the
to
doctors,
have access
things
to
like that, when
mentorships.
we're admitted
And
to the hospital,
as you get older, especially in
there's
your
a
career,
protocol that our medical
you'd be
systems
surprised
have, and oftentimes that
if
is,
you
that's in
if you
conflict
have
with what we
the
believe maybe
idea,
from a
or
religious
if you have
perspective or cultural
questions, you should. I encourage
So
everyone
those
to
are important
ask,
things to
because
take
you'd be
into
surprised how
consideration.
welcoming
So
people
when we
are
kind of
and
tell
willing
the
to share
doctor
their
everything,
experience and their knowledge.
which is very common
so
in the US,
yes,
for
I have
example.
mentors, and
we don't necessarily
it's
sometimes
connected
know what
throughout
that
different
means and what
networks,
that
and
entails and what the
it comes
outcome
from the
of that
basis
is
of
either.
being able to ask
In
questions,
light of
not being
how
afraid
we
to
live,
ask
how our
questions,
culture
and
is,
open yourself
and
up.
I think this idea of cultural competency in the medical profession is really, really important. And unfortunately, it's not at the level where it needs to be, but I think medical professions, especially in urban centers, are really trying to understand how different cultures grapple with things. There is before I finish, sorry, there is a sense of kind of independence and autonomy and decision making that the US values very much, right? That everyone should be able to make their decision for themselves. In our culture, in our communities, there tends to be a more kind of familial autonomy, right? A sense of not just me making a decision about my health, but my brothers will have a say in it, my parents will have a say in it, my children will have a say in it, and others, community members, extended family members, may have a say in it too. So these are things that we go into the emergency room or in any health kind of care situation with. And oftentimes those things are not acknowledged or understood, and I think that causes some frustration as well.
Thank you. Any comments from the audience? Because I'm going to get into an area. I don't have a mic. If you say something, I'll repeat it.
So I think culture is really important. I worked with a group of individuals that are highly driven, they're motivated, they're intelligent, and I think that pushes me to become better. And I think like surrounding yourself with people like that can help you advance both like personally and professionally. But also having people around you where you feel comfortable, where people respect you. I think it gives you the opportunity to grow, to ask questions, to be yourself and kind of push yourself forward. So I would say people is a really important one for me.
Calm down, settle down, doctors come by, they're like, yeah, well, it was interesting that you didn't want to do all this, but it wouldn't have made a difference anyway. And that, to me, was the most important part, was that it wouldn't have made a difference.
So, just one thing I'll say, it might sound a bit cringy, but what brings happiness to me in terms of, always the cliche line is, do what you love and you'll never have to work a day in your life, right? what makes me happy every single day
So
is
that's
every time I go to
thank
work,
you for that.
I literally
really
get
appreciate
to help
that.
an orphan
That brings
child
us actually
come
it's
out
a
of
really
poverty.
good segue to what
in my
we
opinion,
are asking
you
as
know,
a question.
there is
So
no
to answer
better
your
way
question, Samir
to
Bhai,
live life.
this person has dementia.
And to tie that with the
and
previous
is
question about mentorship, again,
he was at
super
not able
cringy
to
line.
make decisions.
Believe me, it
Dementia
comes from a place of
progressed far
humility,
enough
not from a
that
holy
he was
now
not able
space.
to make decisions.
But
right? And that's the truth.
there is so
But
much
now
for us to
comes the
learn
point,
from the
exactly
life
what
of
you're
Imam Ali
saying,
alayhi salam, in terms of just
is
how he
when you're
was
looking
a
at,
leader
you know,
and
the
how
whole
he
cultural, religious
he
angle
executed
and
social
comfort
justice.
care.
And how
right?
fair he was,
So
not just to his
sometimes
companions,
some
not to his
people
friends, but to his
call it
enemies as well.
palliative care,
And
right?
if we
So
simply
palliative
just
care,
live in those
comfort care.
footsteps,
What
and
does
we
that
learn
mean?
from him, believe me,
Right?
there is no better mentor
Because
than that. So
sometimes
just
we
I just
think
literally live by
palliative
that
care,
on a
comfort
daily basis.
care means that we're not actually.
I think for me, I love the daily challenge of, you know,
Dr.
with
Aziz,
what I
what do
do,
you
nothing is the same every day. Everything is unique, and I love the problem solving. I love
So I think
the challenge of just
that's a
figuring
really,
out the
really
next
important
project.
discussion. And to add to this case and to what the wonderful sister said,
For
is
me,
that this
so
particular
just I
gentleman
work for a
in this
community bank in the
case
South
does
Bronx.
not
It's called
have
Spring
an
Bank,
advance
and it's
directive.
very
And so
traditional in
we'll
the sense
talk about
where
that at the
we
end
take
of
the time to
case
get to
and
know our
how
customers
all of this
and
could
understand how is
potentially
it that we can help.
prevented if
And
we
what
have
makes
these
me
conversations in our
fulfilled,
homes
what keeps me happy is the
before
fact
things
that
like this happen.
when you come in
and it is
and
very
you're working with
difficult to talk
customers,
about
9 out of
death
10
and
of our
what the
customers are
end
people that
of
are
life
often
looks
left
like. It is a
behind that
very
don't
hard
fit into
conversation
check
to
boxes
have.
for
It
larger
is hard to have with
institutions.
our parents,
Those
with
are
our
our
siblings,
customers,
honestly, even
and
with
I get to
ourselves.
interact with them,
And it's an
learn
evolving
about
conversation.
what was
Our
their
thoughts
success,
and
what were their
opinions
failures,
change
to
as we
learn
move
their
through life.
background
But having
is
these
something that
documented
I'm
earlier
really
on in
fascinated
the
by and I
system
really
that we
appreciate.
live
So
in
that interaction is huge
crucial
for
so
me.
that we're not
And the
in
fact that,
positions
yes, I work for
where
a bank, but
patients and
the fact that you can have a
families and people
positive
feel stuck.
impact on the
To
community.
your question,
Being
Dr.
based in the
Hassani,
South Bronx,
I
it's the
think,
poorest congressional district in the United
think
States.
that the,
And so
the approach
it was
of
specifically
palliative
mission
care is
driven
a
in being
very,
there,
very
providing
important
financial
field in
services
medicine,
and providing
a field
the
of
people
my
of that
particular
community with
interest,
access to
inshallah,
financial literacy
which is this
and the
idea
ability,
of
the ability to
symptom
be able to grow.
And how
And
do we
last I
think
want to say
about
is the
our
team, being able to
symptoms
connect
and
with
our
our team, being
comfort
able to learn from
and
each
our
other, to learn from each other's
general
experiences,
health
providing
at
that
all
guidance,
stages
and
in life. And it doesn't
being able to teach.
necessarily have to be at the end of life, but it can be for folks who have chronic illness, for example. What kind of pain management looks good for them? People who have nausea, people who have issues with appetite, people who may potentially have such issues that they might have to think about artificial tube feeds or dialysis or surgeries that could be very high risk for their age and their other comorbidities and whatever goes on with them. It's a conversation about what actually does your life look like before.
If there's one thing I would say that you know,
this
I'm sure you've all heard it before, but truly,
our
it's a process, and that it's not a marathon. It's not a race. It's a marathon, and
about
you want to do as much as you can. You want to try to achieve as much as you can, but there's also a part of the process where you're putting in the work and laying out the foundation, and bit by bit you're getting better and you're getting stronger and you're getting more experience, and to not overwhelm yourself with that, to believe in yourself and know that where you come from.
Just, oh my God, now I'm
I would
dying,
say it's
I need pain,
looking back
I'm gonna be DNR.
is something that I would have told myself is
We have to
stay
think
at
about
it,
these
stay
issues
focused,
now.
get better every day.
And I am in my 20s, and I'm actively thinking about what does it even mean for me if I were to, God forbid, be in an accident. God forbid, be in a hospital. What impact would it have on my family, my husband, my in-laws, my siblings, everybody? And you have to have those conversations with yourself too. And I think that's sort of this field of curative versus comfort care. Like we think about this, oh my God, we're dying, now we have to think about it. But I don't think it's that conversation. It's about pain and symptoms, and also asking yourself, how do I live a good life? And that good life is many, many things for people.
Yeah, I just want to make a comment. Thank you, Zamina. I want to make a comment that
To
the research
further on to
clearly
that,
shows-
I think what's really important is for all
the
of you
research
youngsters
really
to know
shows that when you come
that
to the end of life,
success comes
as this
from
person
hard work.
is, Amir Malik
It-
is at
it's
the end of his
school
life.
is not going to really
Okay.
define
shows,
who
the
you are.
research
It's
shows
important,
actually
But success comes from
palliative
one
care
avenue only. It's the
prolongs
effort you
life
put into it. It's the amount
more
of
than
work you
interventional
put into it. That's
People don't
that's
know
the
that,
most important thing
right?
you
They
have to be
think
ready to do.
palliative care means
Just want to ask a quick question.
Right? It's not like that.
Can you
Palliative
raise your
care
hand
is a field
if you're proud
that
of your
actually,
successes
you know,
and your
aggressively
accomplishments?
does that. But I want to come to you.
Clearly,
Samir
we have accomplishments and successes.
Right?
Don't be
You're
shy.
the director
Raise your hand if you're
at
proud of
Columbia
your
University
successes.
of bioethics. So
Can you raise
imagine
your
this
hand if
case
you're proud
was
of your failures?
at Columbia University in bioethics. The clinical ICU
I wasn't expecting it,
team
but
has
I'm
said
glad
to
there are
you,
some hands raised.
You know what? We don't
and
want
the
to
reason
intervene.
why
It's
I
the
asked the
fourth
question
time.
is because
He's
some of
end
the
of
most
life.
important
He's got end-stage
lessons in
dementia.
life
He's
I
got
have learned from my
recurrent
failures.
aspiration pneumonia.
When
He's not
a lot
able
of the
to
times
swallow.
when we feel like roads
And
are closing and
this is
you
end
can
of
put
life.
100%
We don't wanna do
effort
this.
into something because you think
The
you know
son
what you want
says,
out of life.
hell no.
But God has a different plan for you.
I want
And
my
sometimes
dad
we don't see that
intubated
until
right
you
now.
look back.
So
And
now
you say,
they've
oh
come
my
to
God,
you
look
and
how
you
my
say,
life would have
"Can you
been
help us?"
had that road been
What are you gonna do?
successful. And how stunted my growth would have been.
that's a
And
great
because
question.
that
It's a
failed,
difficult
it
question
opened up
because no
these
one really
roads
knows
for
what's
me.
going to happen
And
here.
look how
One
much
thing I would
further I
highlight,
flew.
though, is that,
So
the
do not
Canadian
ever
healthcare
be
system and
disappointed in
US
your
healthcare
failures.
system are different.
Use it as a learning
And I
moment,
think
even
that
if you
also
don't
plays
learn
a
at
critical
that
role in
moment.
cases like this.
Understand that you
In
will
the
one
US,
day
in
look
the
back
UK or in
and
Canada,
realize how
there
much
is
you've
kind
grown
of
from
a-
it.
There are more nationalized systems of healthcare, so there is a rationing, quote unquote, of healthcare resources and things like that. And so there may not be as much leverage in certain countries for people to exercise their kind of individual volitions in these kind of matters. In this case particularly, it's interesting because we had a similar case come up in our ethics committee at Columbia a couple of years ago. And the son, it was a daughter who was adamant that no, everything, do everything. And the clinical team was saying no. They had several conversations with, the specifics of the case were different, but very kind of similar broad circumstances. And the clinical team said, no, we're not going to recommend this. The daughter said, no, you have to do this. And it was even slightly more severe than this one. And they intubated. So they followed kind of the wishes of the daughter. So these things have to be taken into the context of how they're playing out. Who's involved, how much involvement of the family there is, how much involvement of the care team there is, where the patient is as well. Depending on if they're, in the United States, elsewhere, and even within the U.S., where in the U.S. they are. So there's a lot of jurisdictional issues that also come up, legal issues that come up as to what can be done, what can't be done. But in this particular instance, typically in, a major hospital center in the U.S., they would oblige to the son's kind of demands. One thing I would say, though, sorry to continue, is a lot of times in America we have this idea of medicine as being very heroic, right? That, do everything, because we have everything, on our hands to be able to do. But that's not how life has played out, for millennia, right? People are born and people live and they eventually die. And sometimes in my own personal life, I've thought about this. My father, as most of you know, had a very sudden passing. And it was something that was a shock to all of us. And it was interesting because I was actually studying bioethics at the time. And we were talking about kind of the medical and technological imperative, right? How we are able to do so much medically, but ought we be doing these things, right? That's a big question. That we can keep people, in hospitals, on tubes, and in pain for many years. But is that the way someone should be living or not? So that's a question that people in these situations also need to consider and think. And I reflect on my father's situation and how his passing was so sudden and very difficult for us, but how perhaps for him it might have been much less painful than it could have been otherwise. Because when you are in the hospital, you think, oh, well, my dad has a chance, my dad has a chance. You keep trying to do things, right? And where does that end and how much pain and suffering does the person go through?
Go ahead. Kindles, etc. So you have
Sorry, I was just going to add a response. Sorry. I think that I really appreciate your perspective and especially the personal story. And then I think to add as well, you asked about the son. But my counter is, what about the daughter-in-law? Like, what about this woman who has quit her job, who is caring, who is burnt out, who actually knows this, family member, Mr. Malik, more intimately at this point in his life more than the son did. And the son may have known his father for other stages of life, but in the case that we've given, I don't know if we can go back on the slide so the audience can remind themselves, basically the case detailed that the wife of the patient had a very horrible death with cancer. He obviously sounds like he loved his wife very much. There may be a component of low mood and depression after this passing of the wife. There may be also just a natural grief that this person is going through, that in the exhaustion of their own mental and physical challenges that, going to hospital all these times that this patient is facing, that they may also be feeling like this is not the way that I want my family to care for me now. Now I've become, people think that, I've become a burden, or it's become too much now. So there's a lot of emotionality, and I think that the female aspect of it and the caregiver aspect of it is also important, because statistically there's a very gendered aspect to who cares and how caregiving burden is distributed among men and women. And we see that more in the kind of patriarchal communities that we have here in the Koja system, in that a lot of, men may not take on the kind of responsibilities that they ought to, Islamically and or familially, and women may be disproportionately carrying the burden. And obviously it depends on the family, depends on the couple. There's a lot of circumstances. But part of, the ethical thinking is not only, what does the, what is the next in kin, what does the surrogate say legally, and then we do that thing in a crisis situation. But in this situation where he's still on the oxygen, he's not yet ready to be intubated, but we're having these conversations. I always like to think of not what we would do in a medical setting, but what we should do. And I have the privilege, and I think we both have the privilege, of not only being in the field of thinking about these issues, but actually being able to ask these critical questions. Because we can ask these questions of our community, but like the white attending doctor at Long Island, LIJ or North Shore, can't ask these questions without you just, turning a blind eye and being like, well, they don't understand me. But we understand us, and we understand what's going on. So when I'm asking the question of what you would do, it's a very different and critical conversation, an emotional conversation, because it's not the American doctor asking you in terms of the law or the medical choice, but it's us asking us, okay, now really, are we just listening to this one person? Are we looking at how the family is impacted by this? How does this guy go home? Who does he go home with? What does he go home on? Is their house big enough to support X or Y, machine that they need? Do they have enough money? What about the kids? What do they think about it? And I think all of this is a field of ethics called, the ethics of care. How do we actually care for people, and what are the dilemmas that we face in that? And it's not just, autonomy and who makes the choice and what do we do in a crisis situation, but it's also what do we do before a crisis and after the crisis.
Okay. Bit of a chip, isn't she? Yeah. But I'll come to you in a second. Very, very excellent points, right? You talk about the law. You talk about the approach in the U.S. It's actually not very different from how the Canadian system would approach it. In fact, so I actually think it's pretty. And I think the Canadian system in this case will probably end up deferring to what the son wants, right? You talked about an excellent point. What about the daughter-in-law? Because the real caregiver here is the daughter-in-law, right? And she's sacrificed so much. I want to bring the third dimension is, what about Amir Malik himself? You intubate the guy, he's going to suffer. There's no question he's going to suffer, right? So what about his suffering? And now the question then comes, this guy actually was a devout Shia patient. Very religious man, actually. Devout Shia. So the question now is, what does Islam say about this? Sawa basi, asante. Because we think the same way, but you and me think the same way. Yes. Now, religious-wise, because Bakir's thinking was, I'm just going to add more to the scenario. This is the truth. And Bakir's thinking was, okay, the religion tells you that you do everything you can. And so when we talked to him, and he was very happy that I was the physician who was talking to him. But when he was talking to me, he said, Dr. Mitani, this is what Islam says. You do everything. And I said to him, but Bakir, what about the fact that he's going to suffer? Well, if he suffers...
Assalamu alaikum. We will be beginning the breakout sessions in the cafeteria. Right? The first session is going to be talking about the college life experience, so we'll start that in about 3 minutes. We're requesting everybody to move into the cafeteria for that session. All participants who remain for the entire session will be given an extra raffle ticket. For every session you participate in and remain for the entire session, you get an extra raffle ticket. In case, what are our prizes that we're giving away?
You can either
for an iPad, for a pair of AirPods, for Kindles. These are all raffle prizes. To get those extra tickets, welcome to the cafeteria for our breakout sessions.
I think is a better way to look at it. It's from the ethics, from the Islamic ethical point of view, right? So if you talk to Agha, Ayatollah Sistani, Sistani has a guideline. And his guideline is that when somebody is reaching the end of their life, you can withhold treatment, but you cannot withdraw treatment. So Agha says, if you put the tube down, you can't take the tube out. You can't unplug the machine. Right? If you put the feeding tube in, you can't take the feeding tube out. But if somebody's end of life, even if you and the physicians talk and the clinical team feels that you can withhold treatment, so you can decide, I will not put the tube down. Right? Very interesting. So I had a one-on-one with Agha. Alhamdulillah, I got the opportunity to talk to him one-on-one about bioethics and some of the bioethical issues. And I was trying to tell him what the reality on the ground is. You know? And I said, it's not like this on the ground. What if I have only 2 ventilators and they're all full, and I've got a 20-year-old motor vehicle accident sitting in emergency who needs a ventilator? But I have a 95-year-old who I know is end of life, and they're already on a ventilator, and they are suffering. Why can I not withdraw? That's real life. That's what we face. That's the decisions that the doctors are making every day, right? Ayatollah Makarim Shirazi is a wonderful man, actually, when it comes to this area of bioethics. He says, no. You can withhold and you can withdraw. It depends on what the doctor is going to tell you. And he says that suffering is not an option. You have to relieve suffering as much as you can. Right? That's what Ayatollah Makarim says. Right? When I spoke to Agha himself, he looked at me and he said, look, it's coming back to you now. Okay? He said, look, I am telling you it's coming to you, Hasnain, because your community is truly blessed. And I mean that. He said, develop a committee. He called it a committee. I don't know what you call it, a group or whatever. He says, have a committee where you have a physician, where you have a bioethicist, where you have an alim, where you have a wise person of the community, and you guys sit down on a case-by-case basis. Think about what I have given you, because this is, I've given you very high-level guidelines. I don't know what's happening on the front line. He says, you guys talk about it, discuss it, make a decision, and be content. Allahu A'lam. Be content that you have made the right decision. I thought it was a wonderful actually response that he gave, right? It was a bit of an out that he gave, right? But when we spoke to Amir and trying to talk to him about palliative care and comfort care and what religion actually says, it kind of made him a little bit softer. He still wasn't ready, but it made it a little bit softer. So here was Bakir's perspective, right? I don't want to lose another parent. I don't want to become an orphan. Islamically, we have to do everything, prolong life, including intubation. When asked about his suffering current state, it says suffering is required to atone for his sin. And this is what he was saying. Although it is painful for this, he feels this is what Islam would want from us. So we've talked about that. And I think now there's further questions. Sorry? There's a slide before that? Yeah, this is an important slide, right? And so I think this is a slide that Zamina was talking about, right? Sarah is quiet when her husband talks. It's very interesting in the dynamics of the family meeting, right? Bakir was this boisterous, man, right, who felt that he could talk about his father. Sarah, bichari, right? She's just sitting down, right? But privately, she comes up to the clinical team and says, "It is painful for me to see him like this." And every time he comes back from the hospital, he is worse. He becomes more and more frail, right? And because of his condition, this is very important. Because of his condition, my relationship with my husband has deteriorated. And he says, we don't even spend any time together anymore. My kids are affected by this. Remember, she has 2 children, 5 and 8. Right? And I have forgotten even to pack their lunches, and I feel like I'm a terrible mom. See the guilt that's going through her as basically the only caregiver that she is, right? Really important, to understand when you have a case like this, right? So here are some questions, not just for the panel, but I would like to kind of, we talked a little bit, Zamina, about, how the family dynamic would influence your decisions. What role does gender and caregiving in the South Asian culture really, what does that mean? Who makes the medical decisions? Is this Islamic and ethical? So what does Islam say? That only the guy can make the decision? Is that what Islam says? What do you guys think? It's culture, eh? You sure? Are you sure? What about fiqh? What does fiqh say? Jurisprudence. Abba. The eldest son makes the decision. Whoa. Okay. How about if there is no eldest son? Then the daughter. Now we just keep the women in the dungeons, right? So I mean, yeah. So, yeah, eldest son. You see how complex this is, even from an Islamic perspective? I will tell you that there is lots of ulama that will tell you that the decision belongs to the son. And it doesn't matter. So there was one ulama who was consulted in this, and his advice was, you got to intubate, right? The decision is the son's decision, and you cannot overrule that decision. And when we talked when he found out about the daughter-in-law, You'll love this. When he found out about how the daughter-in-law is suffering, the response was with a quotation of a hadith, by the way. It's wonderful. I love ulamas, right? With the quotation of a hadith was that it is better for the daughter to listen to what her husband says and do sabr, because that will be a better reward for her. Interesting perspective. Interesting perspective. What do you think?
I think we should pulse the audience and, make this a little interactive.
Yeah, what do you think?
I'm curious if everyone was to close their eyes right now and just humor me in this experiment, because it's easy to have people who normally say things. But if everyone can just lower your head or close your eyes, we'll do a brief poll. Uncle, I see you cheating. You have to close your eyes.
Bode, close your eyes. No, she wants you to close your eyes.
Okay, at this point in the conversation, for those who are participating in the experiment, who would intubate the patient? Or Mr. Malik, you can raise your hand.
Which means who would put the tube down?
Who would put the tube down and do everything possible? Okay. And then
really?
And then who would think twice and see if there's anything else that can be done? Okay, and who in the group would say, no intubation, nothing like that? Okay, no, that's good. The folks who participated, thank you, sorry, to the rest of you who didn't. But I think it's important because, obviously I know in groups like this, people who normally speak will speak, but it's also important just to see in the room how people feel. And for those of you who participated in the experiment, a lot of people at this junction are thinking twice. And I think that's it's really powerful to see in a group of people where, especially in the context of this particular case and what happened, it is very easy to say, well, let's just, do the thing that is, do everything possible, like, Brother Samir has said. And then that's often what our communities gravitate towards. So it's very powerful that folks are thinking about this. So Fatma Masi.
So there is a few people I really want to make. I've got to come to you guys. Let's just go to Fatima Bhai. Excellent point. So experiential decision making, right? Obviously experience is going to enhance your ability to make decisions, right? So you experience it and that. Now, let me challenge you a little bit. So I know, Fatima Bhai, that you have lost 2 dear parents in a very short time, right? So if you go through it with one parent, does it make it easier to go through it with the second parent? No, it doesn't. They're gonna live forever. Isn't that amazing? It becomes a mess. Okay. This lady here. we're going to get to the living will issue. Let me just take a couple of comments. Oh, wait. Let me just take a couple of comments, and then I'm going to give, I know you guys are dying to say things, okay? I got it. In fact, there is provision for that. So we'll come to you in a second to answer that question. I want to take a couple of the comments we had from the brothers' side. Yes. She had a seizure. Yeah. I don't want to be a muhtaj, meaning I don't want to be a burden. Follow her wishes. Okay. All right. Yes. You wanted to say something.
I thank you, Uncle, for that. I really, really appreciate that perspective. And it's really hard. I think what you said, and then also like what Fatma Masi said, is also really important in the realm of communication and making, the team aspect of these kinds of decisions. And also the technical term of that, like the familial autonomy or the relational autonomy that we talk about in ethics. But my counter perspective is sometimes it's easier said than done. When all the siblings are friends, when all the people in the family are friends, let's say there's a divorce, let's say there's, an ex-partner or, other children or other people, and now everyone else puts their perspective in, and there's guilt, and like you said, religious blackmail, you should do this, Agha said this, people said this, my uncle did that. There's a lot of, looking at other people, compare and contrast. There's a lot of complicated things that happen when families are not nuclear, or when people sometimes, God forbid, don't get along, or if there are different familial circumstances. And I think in those circumstances, having then community support, like you mentioned, for what Agha wants to, this utopia also of what, Dr. Naqvi talked about, that, the idea that we are ultimately not just a religious community, but a village and a family. And having people we can lean on in our community to sometimes help and
Assalamu alaikum, everyone. There are free Quran copies in the front if anyone would like. So please come up to the front if you'd like some.
These areas who understand what the clinical team is saying and who can actually physically talk to you about what does it mean to have a tube down your mouth? How many ribs break when you do CPR? Like, how painful is that? The bruising that doesn't go away, the difficulty breathing that people have for lifelong after they've had CPR. Like, what does that actually look like? And someone from that background can actually help explore that with communities who may not have the kind of communication networks that, the two audience members have described. Because ideally we all get along, but we know that's not the case, and we know that it can be complicated. And so I think that's where we can step in as a broader community. And like you mentioned, I think a lot of other religious communities do this really well. The Jewish community does this phenomenally well. Like, there is not a homeless Jewish person on the streets. Doesn't exist. They come in, they give resources. There are chaplains that go around in the hospital, they're liaisons, and they tell people, okay, don't intubate, don't do this, don't touch the person when they're dead, because they do their own sort of ghusl kafan situation in their own religion. And so having that advocacy in the medical system that we can start in our communities, because there's so many people here, mashallah, and like the slideshows that have gone on, of people who have either experience of caregiving, who may not be in the medical profession, or people who are in the medical profession, who we should be able to, I think, now create networks for support.
So can either of you also, maybe Samir, Bhai, you can, because I just want to, I think oh, she's right there, okay. I just want to come back to the question that was asked. Why don't we figure this out before something happens, right? So you're looking at advanced directives and living wills and so on and so forth. I think there is a MOST form here, we call it MOST in Canada, that determines exactly what should be done. I just want to, before I let you say, Samir, actually you'll be surprised that our Aimma robustly have talked about this. And it's unfortunate we don't talk about their hadith, and how you should be preparing yourself for death, right? Now, when we talk about preparation for death, when it comes to Aimma, then you will see a lot of people, including myself, from the mimbar, right, will tell you about how important it is that you perform good deeds and you worship and all of those good things to prepare for your akhirah. But the Aimma have also talked about your end-of-life decision-making process and how the experience of death for you should be a positive experience and not a negative experience. I mean, the hadith is amazing. There are so many of them. Hundred percent. 100%. So I don't know if there is anybody who will make your desire to have living wills and so on and so forth wajib. I think that is a jurisprudential issue, but highly recommended is already there. So Samir, I'm going to give you a chance to talk a little bit about that, and then I would like to wrap up because I think we're way over time anyway.
Yeah, thank you. Narendra, I think you raised some really important points, of course. And, it's a very difficult area. I think it's a very difficult area to have a conversation with, as Zamina has mentioned. It's an area that we don't want to talk about, really. I don't want to have this conversation with my parents, for example. I don't think anyone really wants to. But it's also a necessary kind of conversation. I think one of the difficulties is that it requires us to also face our mortality, right? Face the fact that this could happen to us or something, and we always want to delay that inevitability. I would say that another benefit of having it, so, we've used kind of some terms interchangeably here, living will, advanced directives, proxy forms, which Zamina told me that there are some proxy forms. Okay, so Zamina has forms for New York. Perfect. So Tasneem Bhai has done this before and has forms, and Zamina has also kindly offered, she's brought forms as well. So if anyone's interested, we do have the resources. The important thing is so we were mentioning advanced directives, living wills, proxy forms. They're used interchangeably. There are different kind of legalese that around them, but colloquially they're kind of used interchangeably. But basically it means that if something happens to me, or if I'm incapacitated where I cannot make decisions for myself, what do I want done? Effectively, broadly speaking. One of the benefits of kind of having some type of form is that it can speak to just a larger issue than what you've actually written down, because it speaks to an intent, right? Inayat Uncle mentioned about his mother, and she said, I don't want to be muhtaj, right? So you know where that person's mind frame is. And that's really, really important, because we cannot anticipate every single thing that could potentially happen to us. But if we can at least speak to the larger issues, if we know, okay, my father is highly independent, or my mother is this way, or then we can use that to also infer intent, right? To try and come up with a decision, if there needs to be made one, that is in line or would likely be in line with what they would want to be done if they're not able to make those decisions. So having these forms is important, one, from a legal perspective, ethical perspective, of course, most importantly, a religious perspective. But it's also a good thing to have because it can speak to a larger view that a person might hold about who they are, their life, and how they kind of see that thing. Oh, and just before, I know we've mentioned a lot of people here who are no longer with us, so maybe if we can recite a Surah Fatiha for Ola Muhammad.
So, thank you for that, Samibai. Zamina, thank you for both of your thoughtful comments. And this is what I mean, right? You've got amazing resources in this Jamaat, with a lot of experts. The idea to present this to you was honestly to make you a bit uncomfortable. Right? So sometimes we do a lot of really feel-good presentation. Because you want to come to the center, you want to leave, you want to feel good, right? Because if you have an alim who recites a real powerful majlis with a lot of Narai Haidaris and all of that stuff, it makes you feel good, right? And you say, oh, that was a feel-good majlis, man, I really liked it, right? And you got somebody like me who's boring and is going to just tell you, how it is. And so, all of these things. But it really is important sometimes when we talk about things that are going to make you feel a bit uncomfortable, right? And you may not have experienced exactly something like this, but I bet you have experienced something similar to this. And I have news for you. This is life. And you will continue to experience these things in life, right? And unless we talk about this as a community, and unless we start to think about the fact that we cannot think of Islam as being this really narrow, focused, that God created me and then He put all these traps in for me so that, if I did this, then I'm going to go to hell. And then if I did this, then I'm going to go to hell. And I can't do this. It's not the way I think of God, right? And I think of God as that merciful creator who created me out of His mercy and out of His love, right? And my own state is how much I love Him. And He says to me that if you love me, then I will make you godly in your nature, right? That's the God that I worship, not the God that puts booby traps for me everywhere so that I mess up, right? And then He just throws me out. So difficult things, but things where I think we need to kind of think about.
Assalamu alaikum. The second breakout session, Beyond the Lab Coat, Careers in Science and Healthcare, with Aliza Raza, Fatma Dirani, Mazhar Bakr, Ruqayya Mitani, and Saira Madad will be starting in the cafeteria just now. Again, if you attend this breakout session, you will earn a raffle ticket for the iPad, AirPods, and Kindles. So again, Careers in Science and Healthcare starting in the cafeteria right now.
They were so quiet. Assalamu alaikum everyone. I just wanted to thank all the speakers today. Thank you all for coming. Before we call Brother Hasnain for closing remarks, I just want to tell you a few things. There's a career fair going on the other side. You guys are more than welcome to go, browse booths. We have some doctors who stayed here. If you want to go visit them, if you have personal questions, you can take their numbers. They are willing to answer your questions and everything. We also wanted to let you guys know that we have 5 more raffle prizes that we're going to announce. And Thank you so much. I'll call on Brother Hasnan Aziz first, and then we'll raffle off prizes. Thank you. I'll time it.
You know, this position is very tough, right? You can never please everybody. But no, look, I don't have any stack of papers today, so I'll make it very, very brief. I listened to my KK group's recommendations last night. But with that said, first of all, can I ask you all to give every one of these professionals who have taken away from their precious time with their families, some even have come all the way from Canada to be with us, a big salawat please for them. Salli ala Muhammad. I would be remiss if I did not thank Ali Jawad and his wonderful wife Shazia. Believe me, the amount of work they've put into this program, behind the scenes, reaching out to all the professionals, making sure they're available on a specific day, taking away someone, we're actually working, taking away from work, just to make all of this possible so our community can benefit. Honestly, this is God's work. This, Wallahi Lazim, if Jannah is there, if Allah doesn't give them Jannah, then I don't know who qualifies for Jannah. Because honestly, they are doing it for Allah's pleasure and nothing but Allah's pleasure. May I ask you please to pray for them, their families, their children, for doing all of this for us, Wallah. Again, salawat for them. Allahumma salli Muhammad wa ali Muhammad. And to all our physicians, Dr. Akbar, thank you for flying all the way from Vancouver for this event. Dr. Ibrahim, you're always there for the community. Of course, when I gave you the ziyarah, I was very worried. But alhamdulillah, you finished on time, so for that. But also what I also want to point out, right, please look around you. Look at the youngsters that we have in this community. I'm looking at Riaz Khalfan's son, Muhammad, you know, just watching him grow, and now he's a physician in our community who's now willing and able to serve the community. And we have so many youngsters. I'm just looking around and I'm just so impressed with this. What a blessing, what a ni'mah. So I hear you, doctor, right? And I hear a lot of the professionals give us some advice that we will form a team comprising of people with different backgrounds, different qualifications, to make the decisions that confront our community members a little easier so they can lean on. And I was just sitting with Uncle Mazahir over there, right? So let me give you something from the heart, okay? You all know, now with this position, I am privy to very confidential information pertaining to our community members. We know those who go through difficulty, right? And we do our very, very best to keep it confidential. And you will see that we keep it very confidential, and it is for a reason. Now, when it comes to this end of life discussions, and we discussed maybe forming a team, like what you said, forming a youngsters team that can come to your homes and help where help is needed. Some of these are qualified PAs. Ali Jawad is a qualified PA, and we have a lot of help available. But he told me, Hasnain, you'll be surprised that some families just don't want to open up to people of our own. Which is a sad situation, because wallah, you know, I've got my wonderful daughter who's a physician. I got my sons, both of them are becoming, one is already a physician, one is on his way. And wallahi al-azim, I told them one thing. I said, you want me to be happy with you? You have to be available for the community. And I took promise to them. I said, when the time comes to treat my community, I don't want to hear you are charging them $1, because you're doing this for them first. It's not about the monetary, it's about serving. And they know this. So with that said, wouldn't it be sad if my community cannot lean on them? If they want to get better, one is an orthopedic, becoming an orthopedic surgeon. If we have so many people with physical injuries, if they don't come to him and open up to him, then why would he be doing this? So I want our community to look at it from their point of view, that they've spent years in education to be qualified, to serve. So if the community doesn't feel comfortable to coming to them and leaning on them, then that's a sad situation, because you have denied them that opportunity to serve you. And believe me, wallahi, the fact that the young man is there is because he wants to serve. So give him that opportunity. And for our community, vice versa, and to those who are professionals, I want to tell them that it is imperative that confidentiality is kept. It cannot come out of you. And that's an oath, believe it or not. That's an oath that you as a physician take, that the confidentiality of your patients is of utmost importance. In fact, when they get their license, and the reason I can tell is because I was there. When Hadi took his medical oath, I was there. They tell them it's an oath that they take, confidentiality of the patients. So I want our community to go away from here knowing that they can count on this confidentiality because they've taken a sacred oath, and vice versa to our professionals, that if you don't serve your community, then it's a big opportunity that Allah gave you that ni'mah that you left on the table. Am I right, doctor? So with that said, a big salawat please for all our volunteers, Rehana Jafar and her team. I know Firdaus was here, I know Ali Shivji, I know a lot of the volunteers behind the scenes have spent the whole night, some can actually work the whole night to set this up. A big salawat for them please. Allahumma salli ala Muhammad. Doctor, you want to end up please? Ali Jawad?
I'll give you the paper. No, you're gonna read.
Oh no, yes.
Sorry, before you guys speak.
Ji.
You always have said salawat for the rest of the community.
Ji.
How about we say salawat for
Ya Allah. Asante sana Abud. Asante sana. Asante sana. Asante. So this is the first winner? Okay, so here we go. You are. More than that too. Okay. So the name here is MashaAllah, MashaAllah. Dr. Firoz Panjwani. You are a winner of one of our gifts today. Salawat please. Allahumma salli ala Muhammad. And by this, Dr. Firoz Panjwani. Okay, the next one? All right, the next one is, now I'm going to ask my daughter here to help me because my eyes are failing me. Aye, yalla, tafaddal.
Oh. It says Tahira Ismail.
Sister Tahira Ismail.
She's at the back.
Shake it up so there's no hanky-panky going on. Okay, who's the next one, doctor?
Navreen Jafar.
Is she here?
Noreen Jafar. If they are not here, then I'm sorry, they are. Yeah. No, they are not here. Nargis Darsi. So Nargis by Darsi. Are you Nargis by Darsi? You are Nargis by Darsi? Okay.
She got one already.
Oh, so she got one already, so she wants to put it back in the thank you. Thank you for your generosity. May God bless you for your generosity, inshallah. And we have Ali Jafar. Ali Ghaffar. Ali Ghaffar. Ali Ghaffar, right?
That's Jafar, for sure.
No, Jafar. Sorry, Ali Jafar. It looks like a G to me. Sorry, Ali Jafar. Hi, okay, Bana, give me. Aye, man. Yes. Okay, Bana, this Bana Akbar Mithani. Akbar Mithani. No, okay, Jafar Devji.
Oh, yes. All right. MashaAllah. Salawat, please.
Allahumma salli ala Muhammad wa ali Muhammad.
One more health journal.
A health journal. Oh, mashallah. Health journal. I already gave mine away, but Arif Darsi. Hi, Arif Darsi is not here. Sorry. Yeah, it's too bad. Too bad he left. Sohail Abdullah.
Lucky lottery tickets up.
He wasn't here for the whole program. I saw you outside.
Thank you, everyone. We can now end here with a small surah. Brother Samir, if you don't mind, sing a small surah, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إذا جاء نصر الله والفتح ورأيت الناس يدخلون في دين الله أفواجا فسبح بحمد ربك واستغفر إنه كان توابا صدق الله العلي العظيم.
to the front and let us know.
Our last panel on the high school to college transition from the parents' perspective will be taking place in the cafeteria. If you would like to join that breakout session, come and join us in the cafeteria. We're starting in 2 minutes' time. We have Brother Ali Sachedina, Brother Ali Hassan Ali, Sister Sharmin Panjwani, Sister Tasneem Megji talking to us about the high school to college transition from the parents' perspective. After that, we will be doing the drawing for the raffle in the main hall. You must be present to win a prize. We still have an iPad, AirPods, a Kindle, and many more things up for grabs. Oh, and we have a missing phone. If you are missing a black Android, please come up to the registration desk and claim it. Okay, if you're interested in the high school to college transition from the parents' perspective, join us in the cafeteria now. If you are interested in the entrepreneurship masterclass, please head to the men's hall. Brother Jawad Khalfan and Sister Zainab Rizvi will be teaching an entrepreneurship masterclass for anyone who's interested in entrepreneurship. Those are our last panels for the evening, and then we'll be doing the drawing for the main prizes. Again, parents talking in the cafeteria, entrepreneurship in the men's hall.
I know. Well, we gotta get out of here early. So anyway. I know. 1:30 or something. Right. So. I'll talk to Buzz about it. Right. Like if it looks like what's this? I'll sign for 4:30. Don't worry about it.
Testing. Oh, very nice. Okay, awesome. The entrepreneurship talk will be starting soon.
I said it before, sorry.
Hello, everyone. Just a quick announcement. The Entrepreneurship 101 breakout session is beginning in the men's hall in about 2 minutes. So if you'd like to join, please come into the men's hall right away. Thank you.
Alright, assalamu alaikum everybody. Are we ready to begin? Yes? Welcome to Entrepreneurship 101. I am Zainab Rizvi. I'm a lawyer who somehow ended up opening up a childcare program. And I'll let Javad introduce himself.
Assalamu alaikum, everyone. Assalamu alaikum, everyone.
They're just more interested in me.
Huh?
They're just more interested.
Yeah, seems like it. No one's wishing me peace. My name is Jawad Khalfan, and I 5 years ago started a small company with one of my best friends, and I feel like I'm living the dream. So happy to share that with you today. Thank you guys for coming, by the way, as well. Let's begin. So, entrepreneurship changed our lives. Anybody a Harry Potter fan? Raise your hand if you like Harry Potter. Very cool. Very cool. Us too. Total nerds. Oh man, this is not working. Here we go. So a little bit about myself. I'm 28 years old, and there's a little bit of entrepreneurship in my family. So I've heard of the word before, and the way many of you youngsters are hearing this word today. So it's a thing. In my life, when I was growing up, I did go into circles of what I wanted to be, from architect to soccer player to real estate developer to mathematicians, all these different stuff, car salesman, literally a lot of different things. And then eventually, at one point in my life, I felt like I had graduated college, I'm working this job, and I'm just no longer happy. And it was hard for me to notice that until this story is 7 a.m. to 7 p.m. was pretty much my work hours for like 2 years straight. And so it was the same hours for one of my friends. And we talked about it, and I'm like, all right, we're out of college, we did everything right, and now we're just working 12 hours a day. Like, dude, this cannot be it. And eventually that conversation led to, hey, let's do something with, something different, led to brainstorming, planting seeds, and eventually one day me and my business partner, who was my best friend at the time, started a company together. So point of that for you guys is anything can really happen. You don't need to have it figured out right away. You can probably go in 8 different directions and still find the best career path for you. My passion comes from, why do I do what I do? I like my own time. I like to be able to spend time the way I want to spend time. And just from that story, you could tell I couldn't. So that's what drives me to continue my business and keep it going. And I like making people happy. So customer service is a huge factor. My why, my mother just walked in, that's my family. I love her very much, and that's also my drive. My parents, my siblings, family is a big motivator to keep going, helping others succeed. And then I'm very inspired by other people's success. We can start from, looking up your dad as a role model, all the way as far as Michael Jordan as a role model, right? They're both human beings. You're a human being. You could look yourself in the mirror and say, what did Michael Jordan have? Some special power, some gift from God? No, he was born a regular guy that put in the work. So, it's been said today already, working hard is going to be the name of the game no matter which way you go. I completely agree with that. Whether you want to be a dentist or you want to be a business owner, you're going to have to work and give it 105%.
I've worn my glasses for this. So, like I said, I went to law school and I had absolutely no plan of opening up my own business. I was very much focused on going to law school, helping people. I was going to work with children from abused families that were experiencing abuse. I was going to work with domestic violence victims. Opening a business never was in the plan. The past couple of years after I graduated from law school, until January actually, I was an operational risk manager at a foreign banking organization. That's what I was doing. But I started something where I was so passionate that I could inspire people around me to become passionate about the same thing, and that definitely helps me continue day to day what I am doing. My passion comes from understanding brain development for children. Over and over again today I've said this. There's a Harvard study that states that between the ages of 0 to 5 is when 90% of a child's brain is developed. Now we live in a society where the goal is to devalue everything. Children go into the school system and they're basically kind of told that the things that they're learning at home may not actually be the way things should be. So if we take that time, that 0 to 5 age range, and we instill values into our children, if we instill the love of Allah, of the Prophet, of the Ahlul Bayt into our children at that age, we're gearing them up for success for the rest of their lives. That's what drives me. That's my passion. My why, like Jawad said, my family, my children. We actually started our in-home program about 2 years ago because I needed a place where I felt comfortable sending my children. And quickly I realized that that's also something that a lot of other Muslim families are looking for. So we continued. Alhamdulillah, I'm very excited to share that, Monday we're opening up a center that has 5 classrooms. I went all the way to China to pick out our furniture. I have traveled to Tennessee. I've been traveling the world to build our business because I feel like it's impactful enough for our entire community. And like I said, I can talk about early childhood all day long, so we'll move on to the next part.
I mean, that's a super inspiring story. Like, when you're a business owner, if the best thing for you to do is to go to China and pick up furniture, you go to China and you figure out how to pick up furniture. That's when people say you got to do whatever it takes to make it work, within, the size or whatever Long Island permits, you just do what you got to do. So that's really cool. The purpose of today, is really to just inspire. That's the main thing we want to leave you with. Is some inspiration for whatever you're interested in and your passions are. So, this is the time to take action, take our energy, and run with it. Oh, so while we're on this slide, could we get some words from the crowd about what they think entrepreneurship really means? And you don't have to, yes. Absolutely. Really nice answer. Any others? Okay. We will give you some words. Ambitious, resilient, noble,
definitely disciplined.
I'll speak to some of these, ambitious, determined, resilient. Those are all in the same energy like we talked about. You got to get stuff done, you got to move forward. And even when things are not going your way, when you take a lot of risk and times are challenging, I think that's one of the biggest parts about the entrepreneur is they're okay with those times. They can handle those times. They make it through those times. It's really challenging, and that becomes your job as someone that's good at challenging situations and problem solving.
And the other thing is also you also have to be empowering to the people around you. So you always, especially if you have other employees, you have to always be a leader to them and be able to support them through their ups and downs as well.
Absolutely. Encouragement, motivation, teaching. So I shared a bit about my story, and there's people of all ages in the room right now, and maybe somewhere along this way of my journey, something lands with you. Growing up, I already mentioned that so many different paths in life that I could have taken, but along the way, it's the people you meet, it's those jobs that you take, and those random opportunities that come about where you typically would say no, but you just end up saying yes. And that yes leads to something out of your norm, out of your comfort zone. That's really where growth happens. That's where opportunities come about. That's what a lot of people that that inspire you, that's one of their secret sauces, is they're more open to opportunities on a regular basis. Those are the people that have explored the world, people that have tried all different foods, who've been around, who have cool experiences to share. So I heard someone today said that a job at an ice cream store or something changed their life. Similar story. I worked at a pharmacy that I feel set up my entire career, where I was just stocking boxes. When I got to college, I was not ready for college at all. I took it super lightly, and I feel like I worked so hard to get in. After the first semester, I almost threw it all away. So that was another really big reality check, where I was like, you don't make it to one point and then like, that's it, you've made it. It's kind of constant battles. After you graduate high school, that's your accomplishment. Well, now you gotta graduate college. Now you gotta get a job. Now you gotta figure out what you're doing next. So instead of looking at it in that perspective where it's like, I do one thing and there's another challenge there waiting for me, you look at it in the way that life is just constantly this up and down, and the more I can be prepared for it and control, how I'm ready for it, it doesn't feel like this all the time, because you know it's coming. When things are great, you're like, all right, well, something's going to come to challenge me, and that's honestly like very Islamic perspective, right? God's always hitting us with new challenges to help us grow, and you got to take those opportunities, recognize them, and be the best version of yourself in those moments, and be confident. So yeah.
So I get to talk a little bit about struggles then. Like I said, I went to law school, failed the bar exam a couple of times, went on to go into the compliance world. I was really good at what I do, by the way. If anyone ever needs legal advice still, I'm pretty on point with what I say, although I usually follow that up with, hey, go find a lawyer though before you take my word for it. But it's usually on point. I continued on after, the bar exam fiasco, which still gives me chills, and went into compliance, moved on to becoming operational risk manager, which, had me working with a lot of policies, procedures, so still following along with the lines of going to law school and utilizing that law degree. I don't think that any step I have taken from high school, from college, from law school, was wasted, because one thing I know is all of it prepared me for where I am today. So yes, there were struggles. Yes, it took a lot to persevere out of those struggles and come out of it, but it brought me to a point where, hey, I've now gone through 14 inspections that I would not have been able to go through if I didn't know how to navigate the world of like rules and regulations, or talking to people, networking. All of the things that I picked up throughout each of the downfalls that I had helped me get to where I am today. And of course you need a little bit of Legally Blonde, like it's hard.
And another thing about that, and everything that we're saying, like I speak for both Zainab and I, that you need to constantly remind yourself of this stuff. Like this is for us as well. Speaking it out loud helps us remember, because we're busy, everyone's busy, your life. Like, how do you remember to implement being positive? How do you remember to implement, looking at life in this certain angle? It's talking about it, surrounding yourselves with people that do that and have those types of discussions, or remind you of that so that you can always remain, the best version of yourself. So, some rapid fire takeaways about, things I really want to leave you with, and hopefully you can implement, act on your crazy random ideas. Just an example, when I was in college, I pursued for about 7 months an invention on how to make a flexible table. It didn't pan out, took up 6 months of my time, but it was super cool and an interesting journey. Failure is part of the journey 100%, so enjoy it. So I already hit it multiple times, like that table, it was a failure, but it was my first business. I got in and out, and I learned, and I gained some confidence and knowledge on the way. So whether you get rejected from a school or a team, or you do bad on a test, don't look at that as like the end of the world. It's just one no, which is getting you closer to that yes, that success over the other side of that challenge. Trying new things, learning about yourself, the compound effect, how every micro decision and action that you do really adds up, both positive and negative. So if every single day you decide to do one push-up or one sit-up, it's not nothing. It will add up, and eventually you'll be able to do 5 that morning or 10. And so don't knock on some tiny little decision to say, hey, I'm going to cut out dessert, that towards my diet. That's a big deal. Every little thing really helps. And on the negative side too, 1 cigarette a day, that is going to really affect your lungs. Not the health session, but little things like that add up. So you really want to be careful. Manifestation, visualizing it, not only that you're seeing it and saying, I can do it, but saying, I'm doing it. It's done. It's happening for me. It will happen, guaranteed. That's what some of these superstar athletes do. That's what very successful entrepreneurs do, and a lot of people do that to get through what they need to do. Like telling yourself, I got this. Getting comfortable with being uncomfortable. And I would say once you guys get into college, for anyone that's in that stage of life, start networking, start meeting people, because your friends, those professors, later on in life, it's really about who you know, and your influencers. This sentence honestly fires me up. It gives me goosebumps, but there is no competition. There is no competition because it's you versus you every single day. When you look into the mirror, it's the person that you saw yesterday, right? But if you make a change, it's you that's going to assist yourself in fixing your own problems. So, like I said, it gets me fired up. I do this a lot. I look myself dead in the eye and I tell myself, like, if I want change, I'm the one that's going to do it. It's the only person. So don't point fingers or don't wait on other people to get your success. Go out there and make it happen.
So, a few more of these rapid fire takeaways. Be ready to accept the hurdles. It's not going to be an easy path. Whether it's entrepreneurship that you decide to do, whether it's finding that 7-to-7 job, it's not going to be easy. There are going to be hurdles, but it'll look like child's play on the other side. You are most influenced by the top 5 people around you. That's like scientifically proven. Choose 5 people. They are the people that influence you the most. So choose your company wisely. Especially when there's negative people around you, try to eliminate them because you don't need negativity around you, right? Maybe not eliminate, literally. You do not grow from what you are familiar with. So be ready to get uncomfortable, like Javad said. Know that there's always an abundance around you. What do I mean by that? There is an abundance of love around all of us. There's an abundance of community. There is an abundance of everything. We just have to look for it. When we look for it, we will feel grateful for it. That gratitude is what's going to drive us. Knowing that everything is available to us, the world is around us. The world's your oyster, right? And have faith in Allah and His plan. At the end of the day, that's all you need. Faith in Allah. Huh? No, that's it. Yeah. So, sorry, the font here is very small. We wanted to add a couple of references to Islam as part of entrepreneurship. There are sayings, I could not find the exact wording of the saying, which show that entrepreneurship is one of the most favored occupations or sources of income for as per the Prophet, I believe. It's a saying from the Prophet, but I don't know the exact wording. However, through the Quran, we have learned that majority of the prophets that I was able to find were entrepreneurs of some sort. So, for example, Hazrat Dawood, he made armor. He sold armor. Allah gave him the power to mold iron with his hands, which is also just a fun, cool fact. Hazrat Idris, he was a tailor. Hazrat Isa, as we all know, was a shepherd. And the Prophet, sallallahu alaihi wasallam, he was a tradesman. We also have that ayat, yeah. No, I never. It's in our messages. It's okay. Moving on.
On like the Islam and business thing, I think if you are, even in your work though, not just for entrepreneurs, right? But we always, every single day, have the opportunity to be like ethical people in our workplaces. And if you own the business, it's even more in your hands to make ethical decisions, take care of your people, give them the right holiday pay, give them the right this. So there's a lot of business ethics, and I think that that's why Islam appreciates, that action of being a business owner, because you're in control of spreading Islam through how you act. You're responsible for a lot of people in that way.
Operating with honesty, integrity. Those, as a business person, as somebody who's in the workforce, those are things to live our lives by.
There was actually a question that someone asked me before the presentation that I forgot to mention earlier, and I'll just hit it now. It was like, I said, these are things to do if you want to be an entrepreneur, be uncomfortable and all that, but what about what not to do, right? Like what to avoid. And I think that something to do is like, don't overdo it, with this all trying to be uncomfortable. Like if you've ever seen the movie Yes Man, Jim Carrey says yes to everything and then he has no time to go to work. He has no time to do this. He's like, it's too much. So same thing, we can fall into that trap of maybe taking on too many, board roles, or, on too many clubs, or committed to too many teams or work projects. And then, because sometimes if you're spread too thin, you can't give 100%. So if you're jumping from every 6 months, you're like, I'm trying something new, you'll never find a career because you never gave it enough time. Or if you're on too many board things trying to get involved and say yes to everything, you're not being a really good team member on all those different groups. So really just, understand that yes, you're trying out there, but your end goal is to find something where you can run with for a longer period of time. Before we go to the next slide, are there any questions thus far? Yes.
So you're gonna feel it in your body, honestly. There are going to be times where you're gonna tell yourself that you need a break. Listen to yourself at that time. There's, self-care, very important. Figure out a lot of the successful people in life. One thing that I've been reading a lot about is that they take the time in the morning to take care of themselves before they take on the rest of their day. So, you wake up for Fajr, you work out, you take some time to read the Quran. I don't follow maybe one of two of those, but you have to listen to your body and be willing to accept it when it's telling you that, hey, you need to slow down a little bit. Do you have anything to add?
Maybe you'll start, not doing some good on certain exams, and you're like, whoa, I used to be a 90s guy, now I'm an 80s guy, because, you're on 3 basketball teams or something. You'll just feel that. For too little, check yourself from last year, 12 months ago, how much really is different in your life? Have you tried anything new? Not you specific, but, that could be a reason why, you might see it's too little. Any other questions? That was a great one, man.
Hussein, did you have a question? No.
Anyone? Now's the time. Open forum. All right, next slide. So, a manifestation activity. So we're going to get a little interactive. So please do your best to participate and give it your 100%. So, to start off, can I get everybody to stand up, please? Thank you. Yes.
Shake your legs a little bit, move your arms. Get some wiggles in.
Get some giggles in. Shake it up. Okay. So, if I could get everyone to kind of, give me their full attention and be silent, I'm going to ask you to close your eyes. Close your eyes and stand straight. Stand straight and really just give me this time. Forget that you're in a room full of your Koja friends and just zone out for a second. Okay? And I want you to imagine where you are 3 years from now. This is your wish list. You don't have to work for it. You don't have to go to school for it. You don't have to fight for it. I'll give it to you right now. Your wish list, imagine it. What are you wearing? Where are you? Who's in your life? Where do you work? What do you do on a Saturday morning? Think about all those little details. and manifest it for yourself. That is you. See that person. Look at them, visualize them. Now take one step to the right. Slowly step into that person's shoes. That is you. You don't have to wait 2 years to wear that, to have that job, to live that life. You can start right now, today. Take one step, one compound effect step towards that person, and keep doing that every day. And you will be that person very, very shortly. And this is an exercise that you could do. It doesn't have to be formal, but you can manifest. So you can open your eyes now and take a deep breath. And I hope that you guys enjoyed this and feel like you took something away from this event today. We have one final gift for you, and it is a ducky. We want you to remember these brilliant ducks. I'll let Zainab explain. Sure.
So Allah subhanahu wa ta'ala has gifted us with one of the most amazing things out there. Is this on? Yes, on. Our brains. I started off by talking about the mind and how between the 0 to 5 age range is when your child, like a brain's develops 90%. Our brains are brilliant. We have the power to use that brilliance to do anything out there. It's a matter of letting ourselves take that step. So when you get your ducks, remember that they're the ducks of brilliance. Hold on to them, and whenever you feel down, just look at it and remember that, hey, our brain is brilliant, and we have the power to do whatever it is that's going to push us forward. That's it.
I'm coming back.
Assalamu alaikum. Thank you for all of those who have been so patient and are still in the hall. We are doing the closing raffle in about 3 minutes. We have some people just getting their raffle tickets in the cafeteria. Oh, I love those boxing gloves. Thanks for showing me. We have some people getting their raffle tickets right now in the cafeteria, and as soon as their tickets are in, we will be doing the final drawing. And I think you all know what's in there. What's in there? Yeah, we have the iPad, the AirPods, the Kindle, and a whole bunch of other things.
Where can we acquire some chocolates? Wow. Don't be tired. I didn't know you did a great job. Our dog. Because I swear. Just kidding, I have one. Just kidding. I don't. You don't have to. I've tried so many times. I think I should get one. Where's the iPad? Where's the iPad? Wait, that's the iPad? Do I have it? Okay, it says. I've seen that with Apple, but I didn't know. Oh, yeah! You don't even do this 3 times. Oh my God! I got it! Get kids! Even though your sister's guys. She wants to give me their Tiana's collecting dogs after she saw me get lost. I want it. You want it? Tiana, you want them? I want a duck. Guys, he's gonna make ducks. I don't. I want a duck. Can I trade? What kind of duck is this? What? Guys, I'll throw it. Whoever gets it. Okay. Give it the duck. I got a free duck. I have a free duck. Yes, I gave him my duck. I can't. Come on. Come on.
Okay, who's ready for the raffle? I see these boxing gloves and you're making me laugh. You're ready? Okay, I'm ready too. You know what? I'm really ready. Before we do the raffle though, I wanted to thank all of you for coming and for spending your day with us. I hope you had a good time. I hope you learned something. I hope you met someone new. Did anyone learn about a new field that they had not thought about before? Yep. Oh, good. Which one? Tell me which one. What did you learn about that was different than you hadn't known about before? Say that again. The firefighter? The firefighter, maybe? The firefighter. I knew it. Yes. Which field did you learn about? The makeup field. Yes, good one. What did you learn? Biomedical engineering. Okay, and you had one as well, Onali? Yeah? No? Okay, that's fine. Okay, great. So we all learned something. Yes? IT. Good one. Okay. So yes, we all learned something new, which was wonderful. And as you know, it was our third year doing this. So we have to say a big thank you to Brother Hasnain Aziz, our president, and his team. Sister Rehana Jaffer in the back there, our chairlady, and her team. They all worked so hard, and it's because of them that we were able to use the center and pull together this program. So before we end, I wanted to call our visiting sheikh to the front to give us a few words. And after he speaks, we'll be doing the raffle. So please welcome Sheikh Rashid with a loud salawat.
Assalamu alaikum, everyone. Are you excited for the raffle? If you bribe me, you get to win. Sure. Even better. So, even better. So, I'm going to share two things with you all, okay? The first one is whatever age you're in, and whatever exposure you've had to careers and different careers and fields in life, the most important thing that you should know as young Muslims is that Allah subhanahu wa ta'ala has granted you and has gifted you with tremendous talent. Okay? There's no one in here who is talentless, who is not intelligent, who's not capable, who's not smart, who's not wise. You have these abilities that Allah subhanahu wa ta'ala has given you, and you have one responsibility. Okay? That responsibility is to make effort, to try, but you have to make effort and try, not for selfish reasons, but for the sake of God. Okay? That's the first thing. So you have endless talent, endless capacity. You have to believe in that, and you have to make effort for God, not for selfish reasons. That's the first one. The second thing is, we may take for granted how amazing and excellent this program was. I come from California, right? San Francisco, so you folks know where that is. You know the great weather. You know we're the best state. All of those things I don't have to share with you. But I can tell you that what happened today is unparalleled. It's peerless. It's unmatched across the country. This is an amazing thing. And sometimes when amazing things happen to us, we take it for granted, right? And the second thing that I want to share with you is this. The way that the volunteers, the people who organized and set this up, the people who were at the booths, the people who spoke with you, the people who emceed this program, all these individuals, they gave their time to this community because they care. And the second thing that I want you to really think about is, how will you give back to this community? What will you do for this community when you're in college, when you're in high school, when you have a job, right? So this community is a home that you should always come back to, right? And really build on it for the next generation. You're young now, but think about 15 years from now, 20 years from now, right? So as you're doing your studies, as you're doing your schooling, really look at this community as a home. And that home is never going to separate from you, okay? So we ask Allah subhanahu wa ta'ala to bless all of you and to bless all of us, to aid you in all of your academic pursuits, but also in your spiritual pursuits, in your understanding of your religion, in your practice of Islam, in your love of Islam, that may all of you have great adab and akhlaq in the way that you understand yourself and also in the way that you deal with your parents, with your community members, with your elders and others. May Allah subhanahu wa ta'ala bless all of you. رَبَّنَا آتِنَا فِي الدُّنْيَا حَسَنَةً وَفِي الْآخِرَةِ حَسَنَةً وَقِنَا عَذَابَ النَّارِ صلى على محمد وآل محمد اللهم صل على محمد. I'm sorry, the salawat was so weak, the raffle prize is cancelled. Alright. Yeah. Wow, even wa'ajil farajahum. You little devils. Alright, enjoy.
That was a nice try, but the raffle is not canceled. We've been announcing it since the beginning. Okay, so we have a bunch of gifts to give away. To help us give the gifts away, I'm going to call Babu Uncle to the front to pull the winning ticket, and I'm going to ask Brother Hasnain Aziz and Sister Rehana Jaffer to come to the front to present the prizes for the winning individuals. Oh yeah, you're clapping for the people who are going to pull the tickets. Wonderful. And I'll just move this out of the way.
Where's Rehana? Rehana! Oh, Hadi, where's your mom? Let's go. I know she's already shy.
Okay. No, so you girls, okay. So we had a bunch of volunteers here, so they're all going to take a chance to pick out one of the prizes. Talia, what's the first prize we're raffling? Pick something from the basket. Okay, what is that? Islamic Brain Box. Sabah Fatima, can you bring this? Babu Uncle's going to pick the ticket. Okay, I hope it's a lucky pick. He's doing it in full view of everyone. There's no cheating here. Okay, you have to read that first. Oh, I have to read that?
All right, here we go. Alina Butwala.
Okay. Congratulations, Alina. Wonderful. Taking a picture? I think so. I see your name. Oh, there we go. From the church.
Let's go. You go. You're in charge. Go. Right here, look.
You got the picture? Oh, a lot of pictures. Paparazzi here. Okay, let's see. Iman, what's the next prize we're drawing for? What's the title of the book? One small step can change your life, the Kaizen way. Okay, Babu Uncle, tell us who's winning this one. No cheating. Okay, Hasnain Uncle. Yes,
ready?
Yeah.
Okay, here we go. Oh, Kumail Sachedina.
Oh, one small step can change your life, Kumail. Give it to oh gosh. Okay, smile for the camera there. Kumail, you have a big cheering gallery here in the front. Okay, let's see. Elena, what are we drawing for next? Oh, okay. And it's the, I forgot what the word is for it, but it's a sensomatic or something Rubik's Cube with the, not sensory, it's it's all the colors are hidden. Rayanli could probably explain it better than me. It's all black, but when you touch it, the colors change, so it's even harder. Okay, Babu Uncle, who's winning this?
I'm taking it right at the bottom.
Right from the bottom.
All right, here we go. Ready? Okay. Samia Sheikh.
Sanya. Okay, one sec. So Sanya, you've won a prize already today. Can I ask you to draw the person who will win this, okay? Because we all know the rules, right? I said it from the beginning that the rules are to win it, you have to be in the hall at the time and no one can win more than once, right? So here we go.
Kai and Panchwani.
Come on down. Thank you, Sanya. No, because they've all done multiple things to get entries. Okay, you can throw it on the floor. Okay, big smile there from Kyan. Let's see, who did Lena, do you want to tell us what we're drawing for next? Okay, we're drawing for the Divine Challenge, an Islamic educational game. Babu Uncle, tell us who's going to win this. Okay, let's see. Who's this?
Ready? Here we go. Wow. Kumail Sachadina.
So Kumail is going to pull who's going to win this. Okay, one sec. I'm going to explain this. So Babu Uncle is asking how people have more than one entry. It's because we had multiple ways to earn entries.
Rehanna, announce. Let's go.
Hisham, who is it? Devjiani.
Hisham Devjiani, come on down. Yes. Oh, it's okay. Yeah. He wants to speak. Okay, hold on. Because we have namaz time and we have three. We'll do the drawing. We have 3 gifts remaining. We'll just draw them quickly and then get everyone to pray. Yes. Do you think we'll be able to get everyone? I think there's a number of parents that are running out the door. Okay. So there is prayer preparations. We're going to do a speed drawing. So I'm going to give this to Babu Uncle, and girls, you just bring up the gifts. Yeah, good. Oh, he's drawing 2 names at once. Okay, the first one he's drawing. Go ahead.
All right, here we go. Ready? Okay. The next winner is small.
It's Hisham again. So we're going to pick another one.
Okay. We're going to go fast.
No, it's
Okay. Saif Kalfan.
You want a book, Safe. Good job. Rehanna auntie.
Zainab Sayed.
Zainab Sayed, you also won a book. Okay, and now we're drawing for the, 1 second, Sabah Fatima has a book for you. Sabah. Okay, take a joint picture. We're going to start drawing for the next stuff. Okay, so we're drawing for the, oh my goodness, one more book. Okay, take your picture. Take your picture. Smile. Cheese. Okay, that was a good picture. Great. Babu Uncle, tell us who's winning. Ekaj, 100 things to be when you grow up.
Sayeda Chaviwala.
Sayeda Chaviwala. Okay, come on down. Okay, and now we're doing the drawing for the 3 big items. You're going to present this while we start.
Do the Kindle first.
Okay, the Kindle. As soon as this picture is done. Okay, Amazon Kindle, Babu Uncle, this better be a lucky one. Come on.
This is what they're waiting for?
No, the iPad is coming soon.
No, okay, here we go. The winner is Sadiq Devjiani.
Okay, congratulations, Sadiq. You just won a Kindle. Hussein Uncle will present that to you while Babu Uncle draws for the AirPods. Okay, Babu Uncle, AirPods. Go ahead. Yeah.
The big one.
The big one, yeah, the AirPods.
Okay, last one.
No, second last.
Second last one. Sabah Panju.
Okay, sorry. Sorry.
Unfortunately, those are the rules.
Doesn't matter.
Here we go. What is this? Sharmin Chaviwala?
Sharmin Chaviwala, you won the AirPods. No. Where's she? She's there? Okay, she's doing her wudu. She's in the hall. She wins the AirPods. Okay, and she's your mom and she's getting the prize. Don't worry. She is not getting penalized for doing her wudu. Yeah, we are going to give it to her. The last prize. Okay, Babu Uncle is drawing for the iPad. Everyone is suddenly reciting surahs. Everyone's suddenly reciting surahs.
And the iPad goes to Hasnain Aziz. Oh, no, sorry. 3 dots. It's too small.
Raya Jaffer.
Riyadh? Raya Jaffer. Is Raya Jaffer here? Oh, wow.
Congratulations. Here, Sister Rehanna will present it to you. Congratulations. Thank you all for participating, for your patience, for staying. We are going to, are we doing namaz in this hall? We are pulling down the curtain and we're reciting Jamaat namaz in this hall. Those that would like to join us for namaz, we are, sorry, change. Jamaat namaz is in the other hall and it's starting, so you're welcome to join in right now. Thank you.
Oh, wait.